Hello and welcome to all of you. So welcome to this one-shot session of pharmacology for FMGE exam June 2023, July 2023 exam. So I am Dr. Saurabh Bhatia and I am your pharmacology guru. So I would be taking this one-shot session for you people, and what I have decided for this session, I have chosen 30 topics for you people. So I have chosen 30 most important topics out of the whole pharmacology which can be asked in your exams, right? So if you go through these topics, at least you will get 50% of your marks in your pharmacology minimum. And by the God grace, if the more questions will come, definitely you can have 80 to 90% of the questions from these topics. So 30 most important topics I'm going to discuss, right? So 30 most important topics we are going to discuss over here. So some topics I will discuss in detail and some topics I will just tell you superficially so that you can read it by yourself later on. So without wasting much of your time, let's start with the first topic, the first topic of your pharma, that is ANS, Autonomic Nervous System. So if we talk about this autonomic nervous system, the first important topic is anti-glaucoma drugs. So you can expect to have one MCQ from anti-glaucoma drug. So every year they have the tendency to ask the question from anti-glaucoma drug. So if we talk about anti-glaucoma drug, we can divide anti-glaucoma drugs in two groups. So anti-glaucoma drugs, you people must be knowing, the patient intraocular pressure is high, aqueous humor is high. So you can give the medicines which can increase aqueous humor drainage. So we have one class of medicines, we call them medicines which can increase aqueous humor drainage. Number two group of medicine which can stop the synthesis of the aqueous humor. So medicines which can increase the drainage of aqueous humor, medicines which can stop the synthesis of aqueous humor. If we talk about the medicines which will increase the drainage, so we have two types of drainage. One is known as trabecular drainage. One is known as trabecular drainage. One is known as uveoscleral drainage. So two types of drainage we have. One is trabecular drainage. Second is uveoscleral drainage. So the medicine which can increase trabecular drainage and increase this flow of aqueous humor and reduce the pressure in the eyes, the medicine is known as pilocarpine. So pilocarpine is an anti-glaucoma drug which can increase trabecular drainage, reduce the pressure in the eyes. Whenever I give pilocarpine eye drop, this medicine is considered as first line drug. This medicine is considered as first line drug for the treatment of acute attack of angle closure glaucoma. So this is one of the first line medicine for acute attack of angle closure glaucoma. So pilocarpine is an important medicine. When given to a patient, one of the important side effect of this medicine is peripheral retinal detachment. So one of the important side effect is peripheral retinal detachment. This medicine can also cause blockage of the punctum. So medicine can cause punctum blockage, medicine can cause peripheral retinal detachment as a side effect. So drug name is pilocarpine. So pilocarpine starts with P, reduce the P, that is pressure, can result in peripheral retinal detachment, can result in punctum blockage as a side effect. Now come to the drug which can increase the uveoscleral drainage. So these medicines are prostaglandin F2 alpha analog. So we have the prostaglandin analog. The classical drug which belong to this class is latanoprost. So latanoprost is a medicine which can increase uveoscleral outflow, and this medicine is considered as drug of choice for maintenance treatment of glaucoma. So overall, best anti-glaucoma drug is latanoprost. Now when we give latanoprost to a patient, this medicine can also lead to some side effects which you can remember by this mnemonic. The mnemonic is pile. So this medicine can cause pigmentation of the iris. So medicine can result in pigmentation of iris. This medicine can result in inflammation in the eyes. So medicine can cause pigmentation in the iris. So iris pigmentation, the drug can cause. Medicine can also result in inflammation of the eyes. So medicine can result in uveitis, keratitis like symptoms. This medicine can increase the length of eyelashes. So medicine can increase the length of lashes. So eyelashes length will increase, and this medicine can also result in macular edema. So drug can result in macular edema as a side effect. So the medicine side effect you can remember by a mnemonic, that is pile. So two group of anti-glaucoma drug we people have discussed. Now let's talk about the medicines which can decrease the aqueous humor synthesis. So which medicines can decrease the aqueous humor synthesis? Medicines are beta blocker. So we have two beta blockers that are given for glaucoma. One is timolol, second is known as betoxolol. So timolol and betoxolol are two medicines which are given for the treatment of glaucoma, and beta blockers are the second drug of choice for glaucoma after prostaglandin analog. Now, timolol is a medicine. When given to a patient, one of the important side effects of this medicine is bronchospasm. So this medicine can cause bronchospasm as one of the side effects. So this medicine should not be given to a patient who is a known case of bronchial asthma and COPD. So in patients of bronchial asthma and COPD, we should not use timolol. So in patients of bronchial asthma and COPD, we can use drug bitoxolol. Now, after beta blocker, we have the medicine. We call them alpha-2 agonist. So, the medicine which is alpha-2 agonist, the drug name is brimonidine. Now, brimonidine is a drug. When given to a patient, this medicine can cause CNS suppression in children. So, this medicine is contraindicated in neonates and children. So, neonates and children, this medicine is contraindicated, should not be given to neonates and children. And one of the important side effects of brimonidine is retraction of eyelid. So this medicine should not be given to neonates and children. One of the side effects of the drug is retraction of eyelid. Number 3 medicine that we use for glaucoma that can reduce the aqueous humor synthesis. So the drug which can reduce the aqueous humor synthesis, the drug is carbonic anhydrase inhibitor. So the medicine is carbonic anhydrase inhibitor. Drug name is acetazolamide. So acetazolamide is given for the treatment of acute angle closure glaucoma along with pilocarpine. And number 4 and the last medicine that can reduce aqueous humor synthesis is mannitol. So mannitol is one more medicine that is given for the treatment of acute angle closure glaucoma. So these are the medicines which are anti-glaucoma drug, can be asked in your exam as an important topic. Now after the anti-glaucoma drug, the second most important topic which I have chosen for you people is alpha blocker. So medicines which are alpha blocker is also very important topic, can be asked in your exam very frequently. So if we talk about the medicines which are alpha blocker, so here you have to read about the drugs which are known as prazosin. So medicine is prazosin. We have one more drug, the drug name is phenoxybenzamine. So we have a medicine, we call it phenoxybenzamine. We have a medicine, the drug name is phentolamine. So phenoxybenzamine, phentolamine, prazosin, and we have one more drug. The name of the medicine is tamsulosin. So we have the 4 medicines, 4 alpha blockers which are important for your exam: prazosin, phenoxybenzamine, phentolamine, and tamsulosin. Now if we talk about prazosin, now prazosin is a drug which is given for the treatment of hypertension crisis that is due to scorpion sting. So this medicine is given for the treatment of hypertension crisis that is due to scorpion bite. So in patients of scorpion bite, prazosin is always given after giving antivenom. So first of all, we will give antivenom, and after giving antivenom, we will give prazosin to this patient for the treatment of scorpion bite. Now phenoxybenzamine is the drug. This medicine is having the word ban in its name. So this medicine is going to ban the tumor. So this is the drug of choice for pheochromocytoma. So this medicine is given to ban the tumor. We call it pheochromocytoma. So this is drug of choice for hypertension crisis that is associated with pheochromocytoma. Now if we talk about phentolamine, now please remember phentolamine is a medicine. It's a drug of choice for hypertension crisis that will occur when you stop clonidine suddenly. So we call it clonidine withdrawal syndrome. So patient who have clonidine withdrawal syndrome, so clonidine is an antihypertensive medicine. If you stop this medicine suddenly, you can have the rebound hypertension crisis. So it's a rebound hypertension crisis which can occur if you stop clonidine suddenly. And for the treatment of this rebound hypertension crisis, phentolamine is the best medicine to be given. Now tamsulosin is a drug which is selective alpha-1A receptor blocker. And because this medicine is selective alpha-1A receptor blocker, this is considered as drug of choice for BPH. So tamsulosin is a medicine which is considered as best medicine for the treatment of BPH. Now when you give tamsulosin to a patient, this medicine can result in 2 important side effects which you can remember by a mnemonic, that is fire. So this medicine can cause side effects like floppy iris syndrome. So FI stands for floppy iris syndrome, RE stands for retrograde ejaculation. So floppy iris syndrome, retrograde ejaculation, 2 important side effects of tamsulosin. So tamsulosin, which is alpha-1A blocker, it's a best medicine for the treatment of BPH. Medicine important side effect is fire, floppy iris syndrome, retrograde ejaculation. Phentolamine is the best medicine for clonidine withdrawal syndrome that will occur if you stop clonidine suddenly. We call it rebound hypertension crisis. Phenoxybenzamine is having the word ban. So this medicine is irreversible alpha blocker. This medicine is irreversible alpha receptor blocker. This is drug of choice for a tumor. We call it pheochromocytoma. And prazosin is given for the scorpion sting. So this is all about this topic, alpha blocker. So first topic, anti-glaucoma drug is important. Second topic, alpha blocker topic is important. Now let's move on to the third most important topic for your exam, that is indirectly acting cholinergic drugs. So we have a topic, we call it indirectly acting cholinergic drugs. So third most important topic is indirectly acting cholinergic drugs. Now the medicines which are known as indirectly acting cholinergic drugs, basically these medicines are inhibitor of acetylcholine esterase enzyme. So these medicines are inhibitor of acetylcholine esterase enzyme. Therefore, the medicines will increase the level of acetylcholine in the body. So these medicines are inhibitor of acetylcholine esterase, increase the level of acetylcholine in the body. Now this acetylcholine will act on the muscarinic receptor, or this acetylcholine can act on the nicotine M receptor and can result in muscle contraction. So these medicines which are indirectly acting cholinergic drugs, these medicines are given to increase the level of acetylcholine in the body by inhibiting this enzyme, acetylcholine esterase enzyme. Now how these medicines can inhibit acetylcholine esterase enzyme? There are two ways. So some medicines are reversible blocker, some medicines are irreversible blocker. So some medicines are reversible blocker of this enzyme, some medicines are irreversible blocker. Now the medicines which are irreversible blocker of this enzyme are poisons for human being, and these poisons are known as organophosphate poison. So patient can come to you with organophosphate poisoning. Patient can also come to you with carbamate poisoning. So patient can come to you with organophosphate poisoning or carbamate poisoning. We call them irreversible blocker of acetylcholine esterase enzyme. So whenever this patient will come to you with symptoms, what are the symptoms of OP poisoning, carbamate poisoning, which you can remember by this mnemonic? The mnemonic is dumbbells. So you can remember by the mnemonic with the dumbbells. So where the D stands for diarrhea, U stands for urination, M stands for meiosis, B stands for bradycardia and bronchospasm. So patient will have diarrhea, urination, meiosis, bronchospasm, bradycardia. Patient can have the epilepsy or the seizure. Patient can have the lacrimation and the salivation. So OP poisoning patient comes to you with symptoms, we call it dumbbells. That is a cholinergic symptoms, we call it dumbbells as a symptom. Now they will ask you the antidote of this organophosphate poisoning. So the antidote of organophosphate poisoning is atropine. So atropine is the antidote of this poisoning. It's a drug of choice, but this atropine is always given along with a group of drugs. We call them oxymes. So atropine is always given along with oxyme, and the medicine which is oxyme, the very famous medicine is pralidoxime. So atropine is always given along with this medicine. We call it pralidoxime. So atropine plus oxyme is a combination that we use for the treatment of OP poisoning as a best management. Out of these two, atropine is considered as drug of choice or antidote of choice. Now if we talk about the medicines which are the reversible blocker of acetylcholine esterase enzyme. Now these medicines further of two types. So some medicines are given to act on CNS. Some medicines are given to act only in periphery. So some medicines are peripherally acting medicine, some medicines will act in central nervous system. So the medicines which will act in central nervous system, the first drug is donepezil. The medicine name is donepezil. Now this donepezil is considered as drug of choice for Alzheimer's disease. So donepezil is the medicine which is the best medicine for the treatment of Alzheimer's disease. Now the second medicine which will act on CNS, the drug name is physostigmine. So the medicine name is physostigmine, which is a tertiary medicine, will act on CNS and can antagonize the effect of atropine poisoning. So this is considered as antidote of choice for atropine poisoning. This medicine is considered as drug of choice for atropine poisoning, or we also call it datura poisoning. So datura toxicity or atropine poisoning is same thing. The antidote of choice is physostigmine. So physostigmine is antidote of choice for atropine poisoning, datura poisoning. Donepezil is the best medicine for Alzheimer's disease. Now the medicines which are peripherally acting, we have three medicines here. The medicines are, number one, the drug name is pyridostigmine. So we have a drug, the drug name is pyridostigmine. Now pyridostigmine is considered as drug of choice for myasthenia gravis. So this medicine is considered as drug of choice for myasthenia gravis. So myasthenia gravis, the best medicine is pyridostigmine. Now the second medicine which belong to this class is neostigmine. Second medicine is neostigmine, right? So pyridostigmine, the best medicine for myasthenia gravis. Now if we talk about neostigmine as a drug. Now neostigmine is a drug. This medicine is given as a drug of choice for reversal of skeletal muscle relaxants. So whenever you have to reverse the skeletal muscle relaxants, so after the surgery, when you want to reverse the effect of skeletal muscle relaxant, so neostigmine is one of the medicine that we can use. Now this medicine is also given for the treatment of cobra bite. So this medicine is also given for the treatment of cobra bite. So pyridostigmine is given for myasthenia gravis. Neostigmine is a medicine that is given for cobra bite, as well as this medicine is given for reversal of skeletal muscle relaxants. Now for the treatment of cobra bite, first of all, we have to give the anti-snake venom. We have to give first of all anti-snake venom, and after giving anti-snake venom, if the patient muscles will not be able to recover, then I will give the medicine neostigmine. So anti-snake venom is followed by neostigmine, but please guys remember, whenever we give neostigmine to a patient, we always give low dose of atropine. Right, so neostigmine is always given with low dose of atropine for the treatment of cobra bite. So first of all, we will give anti-snake venom, then we give neostigmine plus atropine combination. This is a second medicine that is a peripherally acting drug. Now the third medicine is adrophonium. So third medicine which belong to this class is adrophonium. Now where do we use adrophonium? Now please remember, adrophonium is a drug that is given for diagnosis of myasthenia gravis. So we can use this medicine for diagnosis of myasthenia gravis. So this is all about the indirectly acting cholinergic medicines. So first topic is autonomic nervous system, and in autonomic nervous system I have chosen three topics for you people. Number one is anti-glaucoma drug. Second, I have chosen alpha blocker. So anti-glaucoma drugs we have discussed. Second, I have chosen alpha blocker, which is important. Third is this indirectly acting medicines, which can be asked in your exam. Especially you people have to concentrate on the poisoning part, the poisonings and their antidotes, because this part is very, very important. You should be very thorough, like what is the presentation of the poisoning and how we tackle with those poisoning treatment. So which drug is given first, which is given second, you should be thorough with that. Now after this topic of autonomic nervous system, let's move on to the second topic in pharmacology. We call it respiratory system. Now in respiratory system, only one topic is important, that is drugs for bronchial asthma. So if we talk about drugs for bronchial asthma, please remember the best treatment of bronchial asthma is steroids. So best treatment for bronchial asthma is inhalational corticosteroids. So ICS full form is inhalational corticosteroids. So if I ask you this question, which medicines are drug of choice for bronchial asthma? You will answer, sir, inhalational corticosteroids are the best medicines to be given. But this medicine is always given with a bronchodilator. The name of the bronchodilator is formoterol. So inhalational steroids are always given with formoterol. This is overall the best treatment. So we give two medicines in combination always, one steroid, one formoterol, and this is overall a treatment of choice. But out of these two, steroids are the best medicines to be given. Now if we talk about the first class medicine, that is inhalational corticosteroids. So inhalational corticosteroids when given to a patient, some examples of the drugs are like budesonide. So one of the example of the drug is budesonide. One more example is like cyclosonide. So budesonide, cyclosonide are two steroids that we use by inhalational route. Cyclosonide and budesonide. Now whenever we give steroids by the inhalational route, they can ask you the side effect. So one of the side effect of this medicine is oral candidiasis. So these medicines can result in oral candidiasis or oral thrush as a very, very common side effect. Now they can ask you how you tackle this side effect of oral candidiasis. So oral candidiasis is a side effect which can be tackled by giving by some preventive. So there are some prevention of this oral candidiasis. There is one treatment of oral candidiasis. So prevention of oral candidiasis is by the mouth rinsing. You can tell the patient to go for the mouth rinsing if you want to avoid the side effect, that is oral candidiasis, or you can tell the patients to use a device, we call it spacer. So with the help of spacer or mouth rinsing, you can prevent the side effect. But if the MCQ is asked how we treat this side effect of oral candidiasis, so please remember, you will answer we have to give antifungal drugs. So we have to give antifungal drug for the treatment of this oral candidiasis. If we talk about this antifungal medicine, so first of all, we have to give the local antifungal drugs. So we have to give some local drugs, and one of the local drug that I can use over here is clotrimazole. So clotrimazole, miconazole are the medicines which I can give to the patient by the local route. So clotrimazole, miconazole are the medicines which I will give as a first drug to treat this oral candidiasis. Now after the local drug, if the patient disease is not controlled, I will move on to the systemic drug. And if I talk about the systemic drug, the best medicine is fluconazole. So fluconazole is the tablet which I will give by the systemic route, but clotrimazole and miconazole are the two medicines which I can give to the patient by the local route. So these are the antifungal treatment. This is important for your this year exam. So how to tackle oral candidiasis, this we have discussed in detail. So inhalational corticosteroids are the best medicine for bronchial asthma. One of the important side effects of this medicine is oral candidiasis. Now after the steroids, the second group of medicine is, there is a drug which is inhibitor of leukotriene receptor. So they can ask you which medicine is leukotriene receptor inhibitor. The name of the medicine is montelukast. So montelukast is a medicine which is leukotriene receptor inhibitor. They will ask you the medicine, which drug is lipoxygenase enzyme inhibitor given for bronchial asthma. The medicine name is Xyluten. So Xyluten is a drug which is lipoxygenase enzyme inhibitor given for bronchial asthma. They will ask you which medicine is IgE inhibitor. Which medicine is IgE inhibitor given for bronchial asthma? Answer is omalizumab. So omalizumab is a drug which is given for IgE inhibitor. Lipoxygenase inhibitor is Xyluten and leukotriene receptor inhibitor is montelukast. So it's easy to remember. Leukotriene mein we have a drug montelukast. Montelukast is having the word leuko in its name. So montelukast is having the word leuko in its name, so it will act on the leukotriene pathway. Now Xyluten is also having the word leukotriene, so this medicine is inhibitor of the leukotriene synthesis. So by inhibiting the lipoxygenase enzyme, this can block the leukotriene pathway. Now in omalizumab, some students make the mnemonic like this way. Their boy name is Om and Ali. So there are two boys, Om and Ali, and they will fight against the English people. So Om and Ali are Hindu and Muslim. They will fight against the English people. So omalizumab is IgE inhibitor, the second group of medicines that can be asked on the basis of their mechanism of action. Now, third group of medicine they can ask you in bronchial asthma is a drug known as Theophylline. Now, Theophylline is a drug which is important for your exam. Now, this medicine mechanism of action, this medicine has two mechanism of action. This is inhibitor of phosphodiesterase enzyme. So there are two mechanism of action of Theophylline, that is phosphodiesterase enzyme inhibitor, that is known as enzyme inhibitor, and this medicine is also adenosine receptor inhibitor. So this medicine is adenosine receptor inhibitor. So some students make the mnemonic like this way. We can get Theophylline from tea and coffee. So we can get Theophylline from tea and coffee. So just remember this rule, TEA. So T stands for Theophylline. So this medicine is Theophylline. E stands for enzyme inhibitor. A stands for adenosine blocker. So this medicine is Theophylline. It's an enzyme inhibitor. It's a phosphodiesterase enzyme inhibitor. And this medicine is also adenosine receptor inhibitor. So it's a blocker of adenosine enzyme. This is Theophylline. Now just like tea and coffee, when you consume tea and coffee, the medicine has same side effect. So this medicine can cause CNS stimulation. So you people can have insomnia. So when you take Theophylline, you can have the insomnia, you can have the tachycardia, you can have the diuresis as a side effect. So you people can have the tachycardia, insomnia, central nervous system stimulation, insomnia. These side effects can be seen with the drug Theophylline. Now please remember, Theophylline is a drug. This medicine is metabolized by the liver. So Theophylline is a medicine metabolized by the liver, right? So if you consume Theophylline with the liver enzyme inhibitor, if you consume this medicine with the liver enzyme inhibitor like ciprofloxacin, so if you take ciprofloxacin along with this medicine can inhibit the Theophylline metabolism in the body. So this can inhibit the Theophylline metabolism in the body, can result in Theophylline toxicity. So ciprofloxacin is a drug, can result in Theophylline toxicity as a side effect. Right? So this is the drug Theophylline. Please remember the mnemonic T, just from the T. Like if you just remember Theophylline derived from T, you can remember the side effect. You can also remember its mechanism of action. And remember this ciprofloxacin can inhibit its metabolism, result in its toxicity. Now if we talk about the fourth important drug in bronchial asthma is Beta2 agonist. So the medicines which are Beta2 receptor agonist, so these medicines are the bronchodilators. So bronchodilators are also given for bronchial asthma. Right? So medicines can be of two types. So we have some short-acting Beta2 agonist. We have some long-acting Beta2 agonist. So we have short-acting and the long-acting Beta2 agonist, which are used as a bronchodilator for bronchial asthma. So one classical example of short-acting Beta2 agonist is salbutamol, and one classical example of long-acting Beta2 agonist is the drug name is formoterol. So formoterol, one more example is salmeterol. So these medicines are long acting and salbutamol is a drug which is short acting. So any drug which is having the word metro is long acting and the drug salbutamol is a short acting medicine. Right? Now if they will ask you what are the side effects of salbutamol. So side effects of salbutamol can be asked in your exam. So you have to just remember one mnemonic. So medicine can result in 6 side effects. So medicine can result in 6 side effects. So medicine side effects are tremors. So 3 side effects starts with alphabet T. So medicine can result in tremors. Medicine can result in a side effect like tachycardia. So tremors, tachycardia and tolerance. So this medicine is associated with tremors, tachycardia, tolerance as a side effect. Now H stands for hypokalemia. So salbutamol is a drug which can cause hypokalemia. This medicine can also result in hypotension. So everything is going down hypo, but there is one thing which is hyper. So there is only one thing which is hyper, and you have to be very careful about this hyper word, because they can give you 4 options and you have to choose the one option out of it. So all things are hypo, only one thing is hyper, that is hyperglycemia. So this is all about the medicines which are beta-2 agonist and all about the topic that is bronchial asthma. So the fourth topic which I have chosen for you is the drugs for bronchial asthma that we have discussed in detail. Now after this fourth topic, the fifth topic is, now we are moving on to the next, kidney. So diuretics we call them. So the fifth topic where the MCQs can be asked is diuretics. Now among diuretics they can ask you the carbonic anhydrase inhibitors. So medicines are carbonic anhydrase inhibitor. Number 2 they can ask you the mannitol. Number 3 they can ask you the thiazides. Number 4 they can ask you the spironolactone. So these are the important diuretics they can ask you in your exam. So I'm talking about the topic kidney, where the diuretics are the medicines that can act. So the medicines are carbonic anhydrase inhibitor, mannitol, thiazides and spironolactone. So if we talk about the drug which is carbonic anhydrase inhibitor, the drug name is acetazolamide. Now acetazolamide is a medicine. This medicine is drug of choice for acute attack of angle closure glaucoma. So this medicine is drug of choice for acute attack of angle closure glaucoma, and it is given along with pilocarpine as a eye drop. So acetazolamide is given for acute angle closure glaucoma along with the pilocarpine eye drop. Now this medicine is also considered as drug of choice for acute mountain sickness. So high altitude sickness, acute mountain sickness, acetazolamide is the drug of choice. Now this medicine is also considered as second drug of choice for raised ICT. So this is a second drug of choice for raised ICT. Drug name is acetazolamide. Now when I give acetazolamide to a patient, this medicine can cause side effects like metabolic acidosis. So medicine can result in a side effect like metabolic acidosis. This medicine can result in side effect like renal stone. So drug can cause metabolic acidosis, renal stone formation as an important side effect. Now if we talk about the second medicine, mannitol. Now mannitol is a drug which is always given by IV route. Now this medicine is drug of choice for cerebral edema. So this medicine is drug of choice for cerebral edema. This medicine is drug of choice for raised ICT. So this is drug of choice for raised ICT. This is drug of choice for cerebral edema. And this medicine is also given for the treatment of acute angle closure glaucoma. This is also given for the treatment of acute angle closure glaucoma. Drug name is mannitol. Now there is one contraindication of mannitol which is very, very important. This medicine should not be given to a patient of CHF with pulmonary edema. So mannitol should not be given to a patient of CHF, congestive heart failure with pulmonary edema. Otherwise this medicine can precipitate the disease, can aggravate the symptoms of this disease. Now if we talk about the third medicine, thiazides. Now thiazides are the medicines which are inhibitor of sodium chloride pump. So this is the mechanism of action of thiazides. They are the inhibitor of sodium chloride pump. Now these thiazides are the first line drugs. They are the first line drugs for maintenance treatment of hypertension. So thiazides are the first line medicines for maintenance treatment of hypertension. Now apart from that, these medicines are also given for the treatment of hypocalcemia. So these medicines are also given for the treatment of hypocalcemia, and these medicines are drug of choice for nephrogenic diabetes insipidus. So these medicines are drug of choice for nephrogenic diabetes insipidus. And one of the important side effects of thiazide is these medicines can result in hyperglycemia. So these medicines can make the patient diabetic. So thiazides can make the patient diabetic. Important side effect is hyperglycemia, can cause hyponatremia, can result in hyponatremia, hyperglycemia and erectile dysfunction as an important side effect. So medicine can result in erectile dysfunction as an important side effect. Now come to the last medicine, spironolactone. Now spironolactone is the drug when given to a patient. Its important side effects are like the medicine name starts with alphabet S and P. So S stands for sexual side effect. So this medicine can cause sexual side effects. So medicine can result in erectile dysfunction. Medicine can result in gynecomastia. So this medicine can result in gynecomastia as a side effect. So S stands for sexual side effect and the P stands for potassium. So this medicine can increase the level of potassium in the body. So medicine can cause hyperkalemia as well as gynecomastia as a side effect. So spironolactone can cause sexual dysfunction. This medicine can also result in hyperkalemia as an important side effect. So this is all about this topic number 5, that is diuretics. So we have discussed the diuretics in short. the important aspects of these four group of diuretic I have discussed. Now, after this topic of kidney, let's move on to the sixth topic which I have chosen for you, that is cardiovascular system. And in cardiovascular system, the important topic for your exam is ACE inhibitor and ARB. So the medicines which are angiotensin converting enzyme inhibitor and also the angiotensin receptor blocker. So the medicine which is angiotensin converting enzyme inhibitor. The medicine which is angiotensin converting enzyme inhibitor, all these medicines ends with the word pril. So all these medicines ends with the word pril, and the medicines which are angiotensin receptor blocker, all these medicines ends with the word sartan. So all the medicines ends with the word sartan. We call them angiotensin receptor blocker. One example is like losartan. Medicines are like losartan, candesartan, olmesartan. All these are examples. Now ACE inhibitors examples are like captopril, enalapril. Now apart from these medicines, we have a drug which is known as renin inhibitor. We have a medicine which is known as renin inhibitor. So the medicine which is a classical example of renin inhibitor is aliskiren. So aliskiren is a different name. It's a classical direct renin inhibitor. So this medicine is classical direct renin inhibitor. So medicine name ends with the word ren, and before this ren I have the word I. So medicine is inhibitor of the renin. The drug name is aliskiren. So we have medicines like ACE inhibitor and ARBs. So these medicines are important for your exam. So what are the indications of drugs? So please remember, these medicines are the first line drugs. These medicines are the first line drugs for maintenance treatment of hypertension. So these medicines are first line medicines for maintenance treatment of hypertension. These medicines are given for the treatment of congestive heart failure. Now, what is the role of these medicines in congestive heart failure? So please remember, in the treatment of congestive heart failure, these medicines are given to prevent the cardiac remodeling. So in the patients of congestive heart failure, medicines are given to prevent the cardiac remodeling. And when these medicines prevent the cardiac remodeling, these medicines can reduce the mortality. So these medicines are given to reduce the mortality in patients of CHF, or we can say medicines are given to improve the survival in CHF patients. So medicines are given to reduce the mortality. Medicines are given to reduce the mortality, or we can say medicines are given for medicines are given to improve the survival in the patient, right? So medicines are given to reduce mortality as well as given to improve the survival. This is for the cardiac remodeling prevention. Now they will ask you, guys, give me 1 minute. There is the live chat is on. Yes. Yes. Okay, Dr. Paras Patel, I have just started getting the messages from you people. Yes, guys, you people will get this PDF if you want. If you want the PDF, you can get the PDF, right? So this is an important question asked in your last year exam. Which medicines can improve survival? Which medicines can reduce mortality in patients of CHF? The answer is ACE inhibitors and angiotensin receptor blocker, right? So like if they ask you which medicines are best to start here, so there is a drug, we call it Arni. So Arni is the best medicine to be started over here, followed by you will answer ACE inhibitor. Third is ARB. So these are the three medicines you can mark which can prevent the cardiac remodeling, reduce the mortality, improve the survival. Now ACE inhibitors you already know. Any medicine given in the MCQ ends with the pril is ACE inhibitor. Any medicine which ends with the word sartan is ARB. Now what is this Arni? Now guys, please remember, this Arni is a new medicine which can be asked in your exam. This medicine is a combination of angiotensin receptor blocker with a neprilysin enzyme inhibitor. This is a combination of angiotensin receptor blocker with a neprilysin enzyme inhibitor. So combination of angiotensin receptor blocker with a neprilysin enzyme inhibitor. So they will ask you which two drugs are present in this combination. So the two medicines which are present in this combination, the medicines are valsartan and sacubitril. So this medicine is a combination of valsartan plus sacubitril combination, that is ARNI. This is very, very important for your exam. The medicines which can prevent cardiac remodeling and reduces mortality, improve the survival. So medicines are angiotensin receptor blocker and neprilysin enzyme inhibitor. So valsartan plus sacubitril combination we can give to the patient. Now one of the important side effect of this combination is angioedema. So one of the important side effect of this combination is angioedema that you need to be careful. So angioedema is one of the important side effect of this combination. Now, these medicines are given for maintenance treatment of hypertension. They are also given to prevent the cardiac remodeling. Apart from that, these medicines are also considered as drug of choice for diabetic nephropathy. So we are talking about angiotensin converting enzyme inhibitor and ARB. They are the drug of choice for diabetic nephropathy where the patient is having the albuminuria. So any patient who is having the albuminuria, the best medicine to start is ACE inhibitor and ARB. Although this is not that much important, but can be asked in your exam. So three important indications you have to keep in your mind. ACE inhibitor, ARB are the first line drug for hypertension. They are given for the heart failure to prevent the remodeling, and they are also given to prevent the albuminuria in diabetic nephropathy patients. Now, apart from that, if I ask you this question, there is one ARB. There is one ARB, the drug name is losartan. So losartan has some other unique property. So please remember, losartan is a medicine which can inhibit the thromboxane A2. So by inhibiting the thromboxane A2, this losartan also has antiplatelet property. So by inhibiting the thromboxane A2, losartan is a drug which has the antiplatelet property like the aspirin. So like the aspirin, this medicine has antiplatelet property. Now apart from that, this losartan can also increase the elimination of uric acid. So this medicine can increase the elimination of uric acid from the body. So this medicine is also given for the treatment of gout. So losartan has two unique indications. This is given as an antiplatelet drug as well as given for the treatment of gout. Now apart from that, please remember there is one more angiotensin receptor blocker. The drug name is telmisartan. So the medicine name is telmisartan. So please remember guys, telmisartan is a drug. This medicine has anti-diabetic property. So this medicine can control the glucose level in your body. So this medicine can control the glucose level. Medicine has anti-diabetic property. Now being an anti-diabetic drug, how this medicine will act in the body? So please remember, this medicine will act on PPAR gamma receptor. So medicine can act on PPAR gamma receptor and medicine has anti-diabetic property. Drug name is telmisartan. Now, if we talk about other properties of telmisartan, please remember telmisartan is a drug. This is purely metabolized by the liver. Telmisartan is a medicine which is purely metabolized by the liver. So in patients of kidney disease, this telmisartan is safe to use. So in patients of CKD, that is chronic kidney disease, in patients of kidney disease, this is safe to use. The drug name is telmisartan. Now third medicine here is candesartan. So if we talk about important property of candesartan, this medicine is given for the treatment of migraine. So please remember, you can remember like this way, Candy is a name of a girl and in girls the migraine is very common. So candesartan is given for the migraine problem. So Candy is given for the migraine. Telmisartan has anti-diabetic property and it is safe to use in patients of kidney disease. So it is safe to use in patients of kidney disease. So kidney disease, telmisartan is safe, also have the anti-diabetic property by acting on PPAR gamma receptor. And losartan is a drug which has two unique properties. It has an anti-platelet effect as well as this medicine is given for the treatment of gout. So these three important MCQs can be asked in your exam. Right? Now, if we talk about the one important point in the pharmacokinetics, the important point is all ACE inhibitor and ARB. All ACE inhibitor and ARB are the prodrugs. So all ACE inhibitor and ARBs are the prodrugs. So all ACE inhibitor ARB medicines are the prodrug except two medicines. Except two medicines which are not prodrug, and these two medicines are captopril and lisinopril. So captopril and lisinopril are the two medicines which are not prodrug. They are given in the active form. So captopril and lisinopril are two medicines which are not prodrugs. And out of these two, please remember, captopril starts with C, so it's a chota acting medicine, it's a short acting medicine. Lisinopril starts with the L, it's a long acting medicine. So lisinopril is long acting medicine, captopril is a chota acting medicine. So these two medicines are not prodrug, they are given in the active form. Now if we talk about side effects and contraindication of this medicine, if we talk about side effects and contraindications of ACE inhibitor and ARB, so you have to remember this mnemonic. The mnemonic is captopril. So medicine side effect and contraindication you can remember by this mnemonic. The mnemonic is captopril. So in this mnemonic of captopril, please remember these medicines can cause cough and angioedema as a side effect. So medicine can cause cough and angioedema as a side effect. So C stands for cough and angioedema as a side effect. Now this side effect is seen only with ACE inhibitor. This side effect is seen only with ACE inhibitor. This side effect is not seen with ARB. So this side effect is seen only with ACE inhibitor, not seen with ARB, and this is due to the excess accumulation of bradykinin. This side effect is due to the excessive accumulation of bradykinin in the body. So this side effect is due to the accumulation of bradykinin in the body. Now apart from that, this medicine can also increase the level of potassium. So medicine side effect is hyperkalemia. These medicines can result in taste change as a side effect. These medicines can cause orthostatic hypotension as a side effect. So medicines can cause orthostatic hypotension as a side effect. Now if we talk about the contraindication, pregnancy is the contraindication. Renal artery stenosis. Renal artery stenosis, that is bilateral. So bilateral renal artery stenosis is a contraindication, and if the patient's serum creatinine level is more than 2.5, patient's serum creatinine level is more than 2.5, then these medicines are contraindicated. So there are three contraindications back to back. Three contraindications are: if the female is pregnant, these medicines are contraindicated. If the female is pregnant, you will not give this medicine to a pregnant female. Patient is having bilateral renal artery stenosis. Patient is having increased level of serum creatinine. These medicines are contraindicated. Now L is not an important thing to remember. Please remember these medicines can result in lal skin rashes. So these medicines can result in lal skin rashes, that is red skin rashes. So medicine can cause side effect like captopril. So C and A stands for cough and angioedema. P stands for potassium. T stands for taste change. O stands for orthostatic hypotension. Next, P stands for pregnancy. R stands for renal artery stenosis bilateral. I stands for increased serum creatinine. L stands for lal skin rashes as a side effect. So these are the side effects of these medicines, side effects and contraindication, that is captoprils. So this is the fifth topic I have chosen for you. This is important one, sixth topic, sorry. The sixth topic is a very important topic for your exam, right, in hypertension, antihypertensive drugs, sixth topic. Now if we talk about the seventh most important topic for your exam, that is from cardiovascular system again, that is digoxin. So one more drug is digoxin, which they can ask you. So what is the mechanism of action of digoxin? Right, so if they will ask you what is the mechanism of action of digoxin, so please remember this medicine has two mechanism of action. The drug has two mechanism of action. This medicine is sodium potassium ATPase enzyme inhibitor. So this medicine is sodium potassium ATPase enzyme inhibitor. So drug is sodium potassium ATPase enzyme inhibitor, plus this medicine has vagomimetic property. So medicine can stimulate the vagus nerve. The medicine is sodium potassium ATPase enzyme inhibitor. This is the mechanism of action of this medicine. So medicine mechanism of action is sodium potassium ATPase blocker. Medicine has vagomimetic property. Now where I will use the medicine? I will use this medicine digoxin for the treatment of congestive heart failure. I will use this medicine for the treatment of congestive heart failure, and whenever there is a toxicity of this medicine, patient can develop arrhythmias. So patient can develop arrhythmia as a side effect. Now to control this arrhythmias, you have to give an antidote. The name of the antidote is digibind. So digoxin antidote is digibind. So arrhythmia caused by digoxin is best controlled by digibind. Now they will ask you what are the various factors. What are the various factors which can cause digoxin toxicity? So what are the various factors which can cause digoxin toxicity? So the various factors which can cause digoxin toxicity, number one, first is electrolyte imbalance. So because of the electrolyte problem, the patient can develop digoxin toxicity. So the examples are patients who have hypercalcemia. So any patient who has hypercalcemia, any patient who has hypomagnesemia, or any patient who has hypokalemia. So hypercalcemia, hypomagnesemia, hypokalemia are the three electrolyte problem where the patient can develop digoxin toxicity. Number two, any patient who has CKD. So in a patient of kidney disease, the drug cannot be eliminated. In a patient who is old, so in a old age, kidney functions are declined, medicine is not eliminated. Or if a patient is taking a drug known as P-glycoprotein inhibitor. So if a patient is taking a medicine which is P-glycoprotein inhibitor, that medicine can cause digoxin toxicity. So which medicines are P-glycoprotein inhibitor? This can be asked. So the medicines which are P-glycoprotein inhibitor, medicines names are Verapamil. Number two is quinidine. So Verapamil, quinidine are the examples of P-glycoprotein pump inhibitor. We have one more example of erythromycin. So erythromycin, clarithromycin. So erythromycin, clarithromycin are other two medicines which are P-glycoprotein inhibitor, can result in digoxin toxicity as a side effect. Now apart from these factors, please remember any patient who has hyper and hypothyroidism. So any patient who has hyper and hypothyroidism, these patients can have risk of digoxin toxicity. So these are the various factors which can cause digoxin toxicity. Right? Electrolyte imbalance, CKD, kidney disease, old age, if a patient is taking a drug which is P-glycoprotein inhibitor, or the patient suffering from hyper and hypothyroidism. Now I would like to take one query of Dr. Sukhbir Singh. Dr. Sukhbir Singh has asked, what is the difference between absorption of drug and the bioavailability? Sukhbir Singh, we will discuss in general pharma. I'll teach you what is absorption of drug and bioavailability. So in cardiovascular system, we have discussed digoxin and ACE inhibitor, ARB, are two important topics. Now after this cardiovascular system, we can start with the next topic, that is hematology. So let's move on to topic number 8. So topic number 8 is from hematology. Medicines are known as antiplatelet drugs. So antiplatelet drugs are those medicines which are given to inhibit the platelet aggregation. So medicines which are given to inhibit the platelet aggregation. So which medicines are antiplatelet medicines? There are 4 antiplatelet drugs. There are 4 group of medicines which are known as antiplatelets. So what are the examples of antiplatelet medicines? Number 1, first is aspirin. First medicine is aspirin, which is very, very important for your exam. Second medicine is clopidogrel. One more drug belong to this class is ticlopidine. One more drug is prasugrel. So clopidogrel, ticlopidine, prasugrel. Number 3 medicine is apixaban. Number 3 medicine is apixaban. And number 4 medicine is dipyridamole. So we have total 4 medicines which are known as antiplatelets. So which medicines are antiplatelets? Aspirin, clopidogrel, ticlopidine, prasugrel. Medicine name is apixaban and dipyridamole. Now, if I ask you this question, what is the aspirin mechanism of action? So you will say, sir, aspirin is a drug. This medicine is given always in a low dose. This medicine is always given in a low dose, and the low dose of this medicine is 75 milligram to 325 milligram. So aspirin low dose is 75 milligram to 325 milligram, and in this low dose, this medicine is irreversible blocker. So this medicine is irreversible blocker of COX-1 enzyme. This medicine is irreversible blocker of COX-1 enzyme, and by inhibiting the COX-1 enzyme, this drug can reduce the thromboxane A2 synthesis. Now this topic is very, very important for your exam. Aspirin ka mechanism of action, they have already asked so many times in your exam. This is very important. So aspirin low dose given in this dose can block COX-1 enzyme irreversibly, and it's a thromboxane A2 synthesis inhibitor, can be used as an antiplatelet. Now if we talk about the drug clopidogrel, ticlopidine, prasugrel. Now these medicines are inhibitor of ADP receptor. These medicines are ADP receptor inhibitor, which is also known as P2Y12 inhibitor. So we call it ADP receptor inhibitor, P2Y12 inhibitor, and medicines are used as antiplatelet. Now if we talk about a drug apixaban. Now, Efzimfotide is a drug which is a monoclonal antibody. This medicine is a monoclonal antibody. This medicine is glycoprotein 2B3A inhibitor. So this medicine is glycoprotein 2B3A inhibitor, can be used as antiplatelet drug. So some students make the mnemonic like this way, ABC, they write, because Efzimfotide starts from the words ABC. Now they will write 1, 2, 3. So they will write 1, 2, 3 and ABC. So they can remember that Efzimfotide is a drug which given by IV route. So this medicine is given by the IV route, and this is inhibitor of glycoprotein 2,3. So this is inhibitor of glycoprotein 2,3 or 2B3A. So this is Efzimfotide, which is an antiplatelet drug given by IV route. Now in dipyridamole, only one MCQ is important. The MCQ is this medicine side effect. So this medicine can result in coronary steal phenomena. So this medicine can result in coronary steal phenomena, and students make the mnemonic like this way, a person with a mole steal your heart. So coronary steal phenomena, a person with a mole steal your heart. So coronary steal phenomena, side effect of dipyridamole. So this is all about the 8th topic, that is antiplatelet drugs. So in this antiplatelet drugs, aspirin is very important drug. Its mechanism of action is very important. Again, I am stressing upon this point. Second drug which is important is clopidogrel. So clopidogrel is a drug which is ADP receptor inhibitor. And if you can remember one more point, please remember clopidogrel is a drug which required one enzyme of a liver for its metabolism. The name of the enzyme is CYP2C19 enzyme. So clopidogrel is a medicine which required CYP2C19 enzyme of the liver for its metabolism. So for its metabolism, it requires CYP2C19 enzyme. This is all about the 8th topic that is important for your exam. Now let's move on to the 9th topic. Now the 9th topic which I have chosen for you people is anticoagulants. So medicines are known as anticoagulant drugs. So if we talk about the anticoagulant medicines, now anticoagulant medicines are inhibitor of the clotting factor pathway. Now these medicines I can classify in two groups. Anticoagulants which are inhibitor of the clotting factor pathway, I can divide in two groups. So some medicines are known as directly acting medicines. Some medicines are known as indirectly acting medicines. So some drugs are known as directly acting, some drugs are known as indirectly acting. Now if we talk about directly acting medicines, now directly acting medicines are inhibitor of factor 10A, or these medicines are inhibitor of factor 2A. So directly acting medicines are inhibitor of either 10A and 2A. Now the medicines which are inhibitor of factor 10A, all these medicines ends with the word XA-ban. All these medicines ends with the word XA-ban. So it's easy to recognize them in the exam. Medicines ends with the word 10A is going to ban. So factor 10A is going to ban. One of the example is a drug known as Apixaban. One more example is Rivaroxaban. So no need to remember the drug name. Just remember all these medicines which are factor 10 inhibitors are having the word XA-ban in their name. This is factor 10 inhibitors. Now these medicines are given by the oral route. These medicines are given by the oral route. Now if we talk about the factor 2A inhibitor. Now factor 2 is also known as thrombin. Factor 2 is also known as thrombin. So these medicines are also known as direct thrombin inhibitors. So these medicines are also known as direct thrombin inhibitor because they are inhibitor of factor 2. Now what are the drugs which belong to this class? So the medicines which belong to this class, the first example is ergotraben. So again this medicine is having the word ban. Again this medicine is having the word ban, but before the ban they have written thrombin. There's a thrombin ban. So medicine is going to ban the thrombin. Drug name is ergotraben. Medicine is going to ban the thrombin. So drug is ergotraben. Similarly, we have one more drug on this class. The medicine is bivalirudin. So the drug name is bivalirudin. Now if we talk about this medicine bivalirudin, this medicine is having the word bivalent in its name. So bivalent means 2. So this medicine is factor 2 inhibitor. So this medicine is factor 2 inhibitor. The drug name is bivalirudin. Now we have one more medicine of this class. The drug name is dabigatran. We have a drug known as dabigatran. Now if you look at the medicine name carefully, dabigatran. Now dabigatran is having the word TR. That's a thrombin antagonist. So TRAN, thrombin antagonist medicine. This is a thrombin antagonist medicine, or some students make the mnemonic like this way, bi. So dabigatran is having the word bi. Bi means 2. So these medicines are inhibitor of factor 2. Now this dabigatran is the only drug over here which is given by the oral route. So this is very, very important drug for your exam. Dabigatran is important, and here the apixaban is important. So please remember guys, apixaban is factor 10 inhibitor, dabigatran is factor 2 inhibitor. This is easy to recognize in the exam. They are given by the oral route. So all these medicines are given by the oral route. It's important to know about the route also. Now let's talk about the medicines which are the indirectly acting medicines. So if I talk about the indirectly acting medicines, so I can divide indirectly acting medicines in two groups. So there is a drug which is given by the parenteral route, IV or the subcutaneous route, and there are medicines which are given by the oral route. So the medicines which are given by the IV and subcutaneous route, these medicines are low molecular weight heparin. Medicines are low molecular weight heparin. So low molecular weight heparin given by the IV and the subcutaneous route, and any medicine that ends with the word parin. Any medicine that ends with the word parin is a low molecular weight heparin. Any medicine that ends with the word parin is a low molecular weight heparin. One of the example is enoxaparin. One of the example is enoxaparin, dalteparin. All these medicines are low molecular weight heparin. Now, whenever we give these medicines to a patient, these medicines are inhibitor of factor 10 and factor 2 both. They are inhibitor of factor 10 and factor 2 both with stimulation of an enzyme known as antithrombin 3. So they can stimulate one enzyme. We call it antithrombin 3 enzyme. So by stimulation of antithrombin 3 enzyme, these medicines can inhibit factor 10 and factor 2 both. So guys, if you can look at here, if we talk about directly acting are inhibitor of either factor 10 or inhibitor of factor 2. But if you look at the heparin, this is inhibitor of both. This is inhibitor of both 10 as well as 2 by inducing one enzyme, antithrombin 3 enzyme. Right? And if we talk about the antidote of the medicines, so antidote of this medicine is known as protamine sulfate. So the name of the antidote is protamine sulfate. So name of this heparin antidote is protamine sulfate. So protamine sulfate can be used as an antidote of heparin. Right? Now let's talk about the medicines which are given by the oral route. So indirectly acting medicine given by the oral route. So here we have a medicine known as warfarin. So warfarin is a medicine that is given by the oral route. Now apart from warfarin, if you know any drug which has the word coumarin in its name, any medicine which has the word coumarin in its name, like last time in your exam they have given you the drug ace coumarin. So I don't know why they have given this ace coumarin. So ace coumarin they have given in your last December exam. So warfarin or any drug which has the word coumarin in its name, these medicines are inhibitor of an enzyme known as VCOR. So these medicines are inhibitor of an enzyme known as VCOR. VCOR full form is vitamin K oxidoreductase enzyme. They are the vitamin K oxidoreductase enzyme inhibitor. And by inhibiting vitamin K oxidoreductase enzyme, the medicines can inhibit clotting factor number 2, 7, 9 and 10. So they can inhibit clotting factor number 2, 7, 9 and 10. So they can inhibit clotting factors 2, 7, 9 and 10. We call them coumarin and warfarin drugs, inhibitor of vitamin K oxidoreductase enzyme, inhibitor of clotting factor number 2, 7, 9 and 10. Now warfarin is a drug. This medicine when given to a patient, this medicine monitoring is best done by INR. So warfarin monitoring is best done by this parameter, we call it INR. And if I talk about the antidote of this medicine, the antidote of this medicine is vitamin K1. Antidote of this medicine is vitamin K1. Right? Now, if I talk about the status of these medicines in pregnancy, if I talk about the status of these medicines in pregnancy, please remember low molecular weight heparin is the only drug which is found to be safe. So low molecular weight heparin is safe. The rest of the medicines are not given in pregnant females. So if the pregnant female is having deep vein thrombosis, I can use low molecular weight heparin as a best medicine in pregnancy. So in pregnancy, low molecular weight heparin is the safest medicine to be used. Yes, Dr. Paras Patel, heparin can be given in pregnancy. We have just discussed. It cannot cross the placenta. That is all about anticoagulant medicine, the topic number 9. Now let's move on to topic number 10. So if we talk about this topic number 10, topic number 10 is the medicines which are known as thrombolytic drugs. Medicines are known as thrombolytic drugs. Now thrombolytic drugs are also known as fibrinolytic medicines. They are also known as fibrinolytic drugs, thrombolytic drugs. Now, how these medicines will act in the body? So, whenever we give thrombolytic drugs or fibrinolytic medicines to a patient, these medicines will activate tissue plasminogen in the body. So, these medicines can activate the plasminogen. So, they will behave as a tissue plasminogen activator. TPA full form is tissue plasminogen activator. Now, because they will behave as a tissue plasminogen activator, they will activate the plasminogen. They will activate the plasminogen in the body, and plasminogen is converted to plasmin. So, tissue plasminogen activator will activate plasminogen to plasmin. And once this plasminogen is converted to plasmin, these medicines can dissolve the already formed clot. So, basically, thrombolytic drugs are the enzymes. These medicines are the enzymes which are given to dissolve the clot. So, these enzymes are given to dissolve the clot. So, some of the examples are like streptokinase. So, one of the example is like streptokinase. One more example is like tenecteplase. So, tenecteplase, reteplase, LTplase, all these medicines are ending up with the word ase, right? So, they are the enzymes which can dissolve the clot, right? Now, if you look at here, tenecteplase, in tenecteplase, reteplase, you can find out the word T. So, T means tissue, plas means plasminogen enhancers. So, these medicines are tissue plasminogen enhancer medicine. So, its mechanism of action is given in their name. So, tenecteplase, reteplase are the tissue plasminogen enhancers, and these medicines are given for the treatment of ST elevated MI. Medicines can be given for the treatment of stroke. So, medicines can be given for the treatment of ST elevated MI. Medicines can be given for the treatment of stroke. Streptokinase, tenecteplase, reteplase. Now, whenever there is a toxicity of this medicine, we have to give the antidote, and the medicine antidote is known as IACA. So, name of the antidote is IACA, that is epsilon amino caprioic acid. So, medicine antidote name is epsilon amino caprioic acid. So, epsilon amino caprioic acid is the antidote of thrombolytic medicine. If this IACA is not given, you can also mark the second drug, that is tranexamic acid. So, tranexamic acid is a second antidote which I can give to this patient for the toxicity of thrombolytic medicines. So, thrombolytic medicines, toxicity, the antidote of choice is IACA, or second is tranexamic acid. Right? Now, after this thrombolytic topic, this is a 10th topic. Let's move on to the 11th topic. So, if we talk about the 11th topic, the medicines are known as hypolipidemic drugs. So, medicines are known as hypolipidemic drugs. So, if we talk about the hypolipidemic medicines, so these medicines are given to control the cholesterol and the triglyceride level. So, here we have two types of medicines. So, first group of medicines are given to reduce the level of cholesterol. Now, cholesterol is maximally stored in LDL. So, medicines are given to reduce the level of LDL. So, which medicines are given to reduce the level of LDL? The medicines which are drug of choice are known as statins. So, medicines are known as statins. Now, if I ask you this question, what is the mechanism of action of statins? So, statins are the drugs which are inhibitor of HMG-CoA reductase enzyme. So, these medicines are HMG-CoA reductase enzyme inhibitor. One classical example of the drug is rosuvastatin. So, one example is rosuvastatin, one more example is atorvastatin. These medicines are the best medicines to reduce the level of cholesterol in the body. Now, what are the side effects of this medicine? Whenever we give this medicine, these medicine side effects are again HMG. So, these medicines can cause hepatotoxicity. So, medicines can result in hepatotoxicity. These medicines can result in myopathy. So, medicine can result in hepatotoxicity, medicine can result in myopathy, these medicine can result in hyperglycemia as a side effect. So, statins are the best medicine for hypercholesterolemia, or we can say best medicines for excessive LDL level. Now, the second drug that we can use for this hypercholesterolemia, the medicine name is PCSK9 inhibitors. So, medicines are PCSK9 enzyme inhibitors. So, the medicines which are PCSK9 enzyme inhibitor, drug name is evolucumab. So, evolucumab is a monoclonal antibody. Evolucumab is a monoclonal antibody which can result in cholesterol uptake in your body. So, this medicine is having the word CU, And because this medicine is having the word Cu, this medicine can cause cholesterol uptake in your body. So it's a monoclonal antibody which can cause cholesterol uptake. This is PCSK9 enzyme inhibitor. Right. Apart from that, we have one more drug which is given for hypercholesterolemia. Drug name is ezetimibe. So ezetimibe is the third medicine that can be given for the treatment of hypercholesterolemia. Now the second is triglyceride. So there are some medicines which are given to reduce the triglyceride level. So when you reduce the triglyceride, the VLDL level will automatically go down. So when you reduce the triglyceride, VLDL level will automatically go down. And here the best medicines are fibrates. So fibrates are the best medicines to be used. And the classical drug that we use here is fenofibrate. So fenofibrate is the best medicine to be used over here. So any drug which is having the word fibrate is belong to this class, and that medicine is given to reduce the level of triglyceride. Now what is the mechanism of action of fibrate? This is asked in your December exam. So fibrate's mechanism of action they have asked in your December exam. This is PPAR alpha receptor. So this medicine will act on PPAR alpha receptor. So by acting on the PPAR alpha receptor, this fenofibrate is a medicine which can induce lipoprotein lipase enzyme. So this can induce lipoprotein lipase enzyme and reduce the level of triglyceride. So by stimulating lipoprotein lipase enzyme, this can control the triglyceride level. It's a drug of choice for hypertriglyceridemia. So fenofibrate, which will act on PPAR alpha receptor, it's the best medicine to control the triglyceride level. This is all about the 11th topic which I have chosen for you. Now after the 11th topic, the 12th topic if I talk about. So 12th topic is iron toxicity. So iron toxicity they can ask you. So we talk about the patient who is having the thalassemia. So any patient who is having the thalassemia, so this patient can come to you with iron overloading. So which medicines we can use for this iron overloading? So when the patient is having iron toxicity, or patient is a case of thalassemia, repeatedly undergo the blood transfusion. So if your patient is symptomatic, you will give a medicine by the IV route. The medicine name is desferoxamine. So medicine name is desferoxamine, which is given to this patient. So desferoxamine is the best medicine which is given to a symptomatic patient who is having the iron overload. But if your patient is asymptomatic, you can give the medicines by the oral route. So for asymptomatic patient, you can give the medicine by the oral route, and the medicine which is given by the oral route, the medicine name is like deferipone. So medicine name is like deferipone, or there is a drug known as deferasirox. So deferasirox and deferipone are the two medicines which we can give by the oral route. So all these medicines are having the word FER in their name. So you can find out these medicines are iron chelating agents. So medicines which are having the word FER are the iron chelating agents, but desferoxamine is given by the IV route. This is important to know, and other medicines are given by the oral route. This is a 12th topic for you people. Now let's talk about the 13th topic which I have chosen for you people. So 13th topic is anti-emetic drugs. So medicines which are given for vomiting. So medicines which are given for vomiting, we call them anti-emetic drugs. So medicines which are given to control the vomiting. So the most important vomiting for you people is chemotherapy-induced vomiting. So chemotherapy-induced vomiting is maximally caused by cisplatin. So this is maximally caused by cisplatin. We call it chemotherapy-induced vomiting. Maximally caused by cisplatin. Now this chemotherapy-induced vomiting I can divide in two categories. The vomiting that will start within 24 hours of drug intake, I will call it early vomiting. So I will call it early chemotherapy-induced vomiting, and the vomiting that will take place after 24 hours of drug intake. So that is known as delayed chemotherapy-induced vomiting. So we have early chemotherapy-induced vomiting that will occur within 24 hours, and the delayed vomiting that will occur after 24 hours. So the early vomiting drug of choice you people have to mark is 5-HT3 blocker. So 5-HT3 blocker, like there is a drug ondansetron. So ondansetron, but in your exam recently they have asked you this medicine, that is palinosetron. So ondansetron, palinosetron are the medicines which are the drug of choice for early vomiting. So for early vomiting, you will mark ondansetron, palinosetron as the best medicine. Now for delayed vomiting, you will mark the drug of choice as neurokinin 1 receptor blocker. So neurokinin 1 receptor blocker, we also call them substance P inhibitor. So please remember, substance P means pukish substance. P means pukish. Pukish means vomiting. So substance P inhibitor, pukish substance inhibitor, neurokinin 1 receptor inhibitor. The drug name is aprepitant. So aprepitant is a medicine which is neurokinin 1 receptor blocker. It's a substance P inhibitor. Right? So some students make the mnemonic like this way. If you come early, you will get the seat. If you come early, you will get the seat. So first come, first serve basis. If you come early, you will get the seat and you will be asked to sit on the chair. But if you come late, then you will be, आप लोग पिटोगे. Right? So if you come late, आप लोग पिटोगे. Pito means like we will beat you. So if you come late, आप लोग पिटोगे. If you come early, we will let you to sit on the chair. So early vomiting, citrons. Late vomiting, pitants. So late vomiting, pitants. Early vomiting, we will give citrons. This is for the chemotherapy-induced vomiting. Now, the second drug that I can use for this delayed vomiting is dexamethasone. So dexamethasone is a second medicine that I can use for this delayed vomiting. The third medicine which I can use for this vomiting is olanzapine. Olanzapine is a third medicine that I can use for this vomiting. So dexamethasone is a second drug. Third medicine is olanzapine that I can use for this delayed vomiting. Now in December exam, they have asked you, a patient is taking cisplatin based regimen. Now which drugs you will give to control the vomiting caused by cisplatin? Now guys, please remember, whenever the patient is taking cisplatin based regimen, you have to give all the 4 medicines together. You have to give all these 4 medicines together. So in this year exam, they have given you 4 options. They are given you 4 regimens, and these 4 medicines are given together for the treatment of this chemotherapy induced vomiting. So chemotherapy induced vomiting, these 4 medicines are given together for the treatment of this cisplatin induced vomiting. This is important because last year in your exam, this question was asked. Again, this can be asked this year. Now the second type of vomiting is morning sickness. So if the patient is having morning sickness, you know that the drug of choice for morning sickness is doxylamine. So doxylamine plus vitamin B6. So doxylamine plus vitamin B6 combination is given for the best treatment for morning sickness. So best treatment for morning sickness is doxylamine plus vitamin B6 combination we can give. Third is now motion sickness. Now which medicines we can give for the treatment of motion sickness? So morning sickness, doxylamine plus vitamin B6. For motion sickness, you will give hyoscine. So hyoscine is the best medicine, but if it is not given in MCQ, you will go for promethazine. Guys, for your exam, promethazine is more important drug to know instead of hyoscine. So hyoscine is not commonly used in India. So promethazine is a more common drug that can be asked in your exam for motion sickness. Now, apart from that, we have one more group of medicine, that is dopamine 2 receptor blocker. So we have dopamine 2 receptor blockers. These medicines are also given for vomiting. The medicines are like domperidone. So 2 more medicines are domperidone and metoclopramide. So domperidone, metoclopramide are 2 more medicines which are given for this vomiting. Now in this domperidone and metoclopramide, please remember, metoclopramide is a drug which can cross blood-brain barrier. So metoclopramide is a medicine which can cross blood-brain barrier, and because this medicine can cross blood-brain barrier, this medicine can result in Parkinson's-like symptoms. This medicine can result in Parkinson's-like symptoms in CNS. So drug is responsible for Parkinson's-like symptoms. So it can cross blood-brain barrier. Medicine can result in Parkinson's-like symptoms because it can cross blood-brain barrier, metoclopramide. Now this side effect is not seen with domperidone. So Parkinson's-like symptoms means body movement disorder. So medicine can result in body movement disorder as a side effect. So this is all about this topic, that is vomiting. This is the 13th topic which I have chosen for you. Now let's move on to the 14th topic. If we talk about the 14th topic, that is based on the general pharma. So in general pharma, they can ask you the clinical trials. So they can ask you the clinical trials in general pharma. So if we talk about this clinical trials, so we have 3 phases of clinical trials. So we have total 3 phases of clinical trials. Topic number 14, clinical trials, different phase of clinical trials. So we have phase 1, phase 2 and phase 3 clinical trial, right? So phase 1 clinical trial is also known as safety studies, also known as toxicity studies. So this is known as safety studies and toxicity studies, right? So in this phase 1 trial, normal human volunteers will be made as a sample. So normal human volunteers will be the sample in phase 1 trial, also known as safety studies and toxicity studies. Now in this phase 1 trial, we people calculate the toxic dose. So we people calculate the toxic dose, also known as maximum tolerated dose. So we people calculate toxic dose and maximum tolerated dose. But in phase 2 trial, this is also known as proof of concept. This phase is known as proof of concept, right? So here the patients are admitted. Here the patients are admitted, and here we will calculate the therapeutic dose. So here in this phase 2, we calculate the therapeutic dose, and here in this phase 2, there is a maximum risk of drug failure. There is a maximum risk of drug failure that will take place. So maximum risk of drug failure will take place in phase 2. If we talk about phase 3, now phase 3 is also known as multicentric trial. This is also known as multicentric trial. So phase 3 is known as multicentric trial, where we have the maximum number of patients. So maximum number of patients are included in phase 3. So maximum number of patients are included in phase 3. This phase requires the maximum resources. So maximum resources are utilized. Maximum resources are utilized in phase 3. Now, whenever you want to compare two drugs, so comparison of drug is also made in phase 3. So basically, phase 3 is the best phase to calculate. It's a best phase for all pharmacokinetics and pharmacodynamic parameters. So phase 3 is the best phase for all pharmacokinetic and pharmacodynamic parameters. So whenever you want to calculate any kinetic or dynamic parameter, phase 3 is best. Whenever you want to compare two or more drugs, phase 3 is best. This phase will require maximum consumption of your resources. Maximum number of patients are the part of this phase 3 trial, also known as multicentric trial. So basically everything is best in phase 3. And after the phase 3, drug will get the approval. So drug will get approval after the phase 3. So drug is launched in the market after phase 3. Now the moment the drug is approved in the market, now the medicine phase 4 starts. So phase 4 of the trial will start after the drug is launched in the market. So phase 4 is also known as post-marketing surveillance. So phase 4 is also known as post-marketing surveillance. So post-marketing surveillance is a name of phase 4 trial, right? So this is all about the clinical trials, the topic number 14 which I have chosen for you regarding the clinical trials. Now let's talk about topic number 15. So topic number 15 is regarding the log DRC. So log DRC, log dose response curve, is important for your exam. So they can be asked like in this log DRC, like if we draw the shape of log DRC, the shape of log DRC is like this. Right, so it's a sigmoid shape. So log DRC, the shape is sigmoid shape. So log DRC, the shape is sigmoid shape. So in this log DRC, they will ask you, what does this x-axis will tell you? So x-axis will tell you about the drug potency. So x-axis will tell you about the drug potency, and any medicine DRC is on the left side of the other. Any medicine DRC is on the left side of the other drug. If the medicine DRC is on the left side of the other drug, that medicine is more potent on the x-axis. So if the medicine DRC is on the x-axis, left side of the other drug, it means that medicine is more potent. If the medicine DRC is on the right side of the other drug, that medicine is less potent. Like if we draw the diagram, these are the 2 or 3 medicine. This is A, B and C. Then I will say A is most potent, followed by B, then C. So more is on left side, more is the potency. More on the right side, less is the potency. Now they will ask you, what does this y-axis stands for? So please remember, y-axis will give you the information about the drug efficacy. So x-axis gives you the information about potency. Y-axis of the DRC gives you the information about the efficacy. And one very simple rule is, more is the height. More is the height of DRC. More is the height of DRC. It means that drug is more efficacious. It means that drug is more efficacious. So more is the height, more is the efficacy. Less is the height, less is the efficacy. Like if I draw the graph, like these are the 3 medicines. These are the A, B and C. Then I would say A has maximum efficacy, followed by C, then B. So in this way, I can find out. Now apart from this X and the Y-axis, they will ask you in this graph, what is therapeutic index? So they will ask you, what is therapeutic index? So you will say therapeutic index is a ratio of LD50 upon ED50. So therapeutic index is a ratio of LD50 upon ED50. Now they will ask you what is LD50. So please remember dose at which 50% mortality is observed. So dose at which 50% mortality is observed in animal experiment. So dose at which 50% mortality is observed in animal experiment. This is known as LD50. Now what is ED50? So it is same as LD50, dose at which 50% effect is produced. So instead of using the word mortality, I will use dose at which 50% samples will respond to the treatment. 50% samples will respond to the treatment, 50% effect is produced. That is known as therapeutic index. Now they will tell you what does this therapeutic index gives you the information. So please remember therapeutic index will give me the information of safety. So this will tell me about the drug safety. So therapeutic index will tell me about the drug safety. Is the third point about regarding this DRC. Now fourth point regarding DRC. With the help of DRC, we can also see the effect of competitive versus non-competitive block. So we can also see the effect of competitive versus non-competitive block. So what is competitive block? So please remember, in competitive block, your DRC is shifted towards right side. So right side shift of DRC. So whenever you see in your exam, the graph is shifting towards right side. Like one graph is made on the left side, the drug is same, drug is A only. So drug graph is shifting towards the right side. It means it's a competitive block. And when the drug graph is getting flat, this is known as flattening of DRC. So what is the flattening of DRC? The slope of this graph. The slope of this graph is getting flat. So when the slope of the graph is getting flat, we call it flattening of DRC. So this is drug A, this is again a drug A. But the drug A efficacy is declining. This is showing you the non-competitive block. So this is non-competitive block and the left one is showing you the competitive block. So with the help of DRC, you can see the effect of competitive as well as the non-competitive block also. Now with the help of this DRC, you can also see the effect of tolerance. Now what is the tolerance? The tolerance is like when you give the medicine, gradually the medicine graph will start declining. So when the medicine graph will start declining, this will show you the medicine tolerance. Right? So these are the 5 informations which we can get from this DRC. So this is the DRC important topic for your exam, topic number 15. Now let's move on to topic number 16. So if we talk about this topic number 16, so in the same general pharma, the topic number 16 is the type of receptors. So second thing they can ask you, the type of receptors. So where do we have the types of receptors? So if we talk about the types of receptor, right? So we can classify receptors in grossly 4 groups. The first type of receptors are known as nuclear receptors. The second type of receptors are known as cytoplasmic receptor. So first is nuclear receptor, second is cytoplasmic receptor, third is receptors present in cell membrane associated with kinase activity. And the fourth type of receptors are present in membrane. Fourth type of receptors present in membrane but associated with G protein. We call them G protein coupled receptors. So we have four types of receptors based on their location. Number 1, we have the nuclear receptors, we have the cytoplasmic receptor, we have the receptors present in membrane associated with kinase activity, and we have the receptors present in membrane associated with G protein activity. So if I ask you this question, which receptors are known as nuclear receptor? So you have to remember this mnemonic, that is TAPE. So in this mnemonic, TAPE stands for thyroid hormone. So receptors of thyroid hormone is nuclear receptor. Vitamin A receptors are nuclear receptor. Next is PPAR receptor. PPAR receptor is a nuclear receptor. And the fourth one is estrogen receptors are the nuclear receptors. So there are 4 receptors which are the nuclear receptors. One is T3, T4. Second is vitamin A. Third is PPAR. Fourth is estrogen receptors. Now if we talk about the cytoplasmic receptors. Now cytoplasmic receptors are associated with all steroidal drugs. So whatever steroidal drugs you know, we have the cytoplasmic receptors. So what are the steroidal drugs? Like we have the glucocorticoid medicines like prednisolone. So one example of steroid is prednisolone. So prednisolone receptors are cytoplasmic receptors. Now we have some sex steroid also. We have some sex steroid also like estrogen, testosterone, progesterone. So sex steroids, glucocorticoids, they have the receptors present in cytoplasm. Now apart from that, we have the vitamin D receptor. We have the vitamin D receptor present in cytoplasm. So vitamin D receptor present in cytoplasm and glucocorticoid sex steroid receptors are present in cytoplasm. If we talk about the membrane receptor with kinase activity, so membrane receptor with kinase activity, the mnemonic is PIG. So we have the prolactin. So we have the prolactin present in prolactin receptors present in membrane associated with kinase activity. We have the insulin. So prolactin, insulin, we have the growth hormone and we have the growth factors. So growth hormones and growth factors receptors are present in membrane associated with kinase activity. So prolactin, insulin, growth hormone, growth factors, and the last is G protein couple receptor. Now all other medicines, all other drugs will act on G protein couple receptors. So all other medicines will act on G protein couple receptor. Now if we talk about MCQs based on G protein couple receptor, now the G protein couple receptor has a 7 helical shape. So the shape of G protein receptor is 7 helical shape, 7 serpentine shape. Now the receptor which is present over here, the G protein which is present over here is known as G alpha. So the G protein present in this G protein receptor is known as G alpha. Now this G alpha protein can be of 3 types. So G alpha protein is present in it is associated with this G protein receptor. So this G alpha protein can be of 3 types. So we have the G alpha known as G alpha S, G alpha I, and we have G alpha Q or not. So we have G alpha Q or not. Now G alpha S is stimulatory. This will increase the level of cyclic AMP. We have G alpha I which is inhibitory. This will decrease the level of cyclic AMP. And we have the G alpha Q that will increase the level of IP3 and DAG. This will increase the level of IP3 and DAG. Right? So this is G alpha Q for you. This is all about the types of receptor, the third most important topic in your general pharma. So topic number 16 I have covered. Now let's move on to topic number 17. Now topic number 17 is from autocoids. So if we talk about this topic, autocoids. So in autocoids, the treatment of gout. So treatment of gout, these people are asking. So please remember, in the treatment of gout, patient can come to you with acute symptoms of gout. So patient can come to you with acute symptoms of gout, or patient wants the maintenance treatment of gout. So patient wants treatment of acute symptoms, patient wants maintenance treatment. Now for the acute symptoms of gout, please remember guys, drug of choice is NSAIDs. So best medicines are NSAIDs for the treatment of acute gout, but generally we avoid using a medicine aspirin. So aspirin generally we don't use for gout, but NSAIDs are the best medicines to be used. Like I can use a medicine known as diclofenac. So diclofenac is one of the painkiller which I can use for the treatment of this symptoms of gout. Now after this NSAIDs, the second group of medicine which I can use is steroids. So steroids can also be given for acute symptoms. Now third medicine which I can use for acute gout is colchicine. So colchicine is a third medicine which I can use for the treatment of gout. So colchicine, steroids and NSAIDs are the best treatment for the gout. Acute symptoms mein NSAIDs are the best medicines. Now for the maintenance treatment of gout. For the maintenance treatment of gout, I have two group of medicines. The first group of medicines are those which are uric acid synthesis inhibitors. So we have the medicines which are uric acid synthesis inhibitor. So these medicines inhibit uric acid synthesis by inhibiting one enzyme. The name of the enzyme is xanthine oxidase enzyme. So by inhibiting xanthine oxidase enzyme, the medicines can inhibit the uric acid synthesis. So uric acid synthesis is inhibited by inhibiting the xanthine oxidase enzyme, and the overall best medicine for maintenance treatment of gout is allopurinol. So this question is asked in your December exam. Allopurinol is the best medicine for the treatment of gout. So acute attack mein we will give NSAIDs, but for maintenance treatment, allopurinol is the best medicine to be given. Now, the second medicine which I can use as a xanthine oxidase inhibitor is febuxostat. Second medicine is febuxostat, which I can use as a xanthine oxidase inhibitor. So medicine is having the word XO. It's a xanthine oxidase inhibitor. Drug name is febuxostat. So these are the drugs which are uric acid synthesis inhibitor. Now we have the medicine which can increase uric acid elimination from the body. So medicine which can increase uric acid elimination from the body. So the medicine which can increase uric acid elimination from the body, the medicine name is probenecid. So medicine name is probenic acid. So we also call it probenic acid and probenecid. So probenecid can be used as a uricose-uric drug. We can also use a medicine known as losartan. So losartan is one more drug which I can use as a uricose-uric medicine. So uricose-uric medicine, I can use losartan. I can use this medicine probenecid for the treatment of this uric acid elimination. So these are the medicines which I can use for the treatment of gout. So topic number 17 I have chosen for you people is gout. Right. Now let's move on to topic number 18. Now if we talk about topic number 18, so in topic number 18, the topic is anti-cancer drugs. So if we talk about this topic, anti-cancer drugs, so please remember, one of the important, if we talk about the side effects of anti-cancer drugs, one of the important side effect of anti-cancer drug is chemotherapy-induced nausea vomiting. So chemotherapy-induced vomiting is the most common side effect of anti-cancer drug, and how to tackle this chemotherapy-induced vomiting, that we have already covered. So we have already covered in topic of antiemetic drugs. Now the second important side effect of anti-cancer drug is bone marrow suppression. So anti-cancer drugs can cause bone marrow suppression as a side effect. Now how to deal with this bone marrow suppression? So in this bone marrow suppression, patient WBC count can go down, patient platelet count can go down. So patient WBC and the platelet count can go down. Now to improve this WBC count, we will give one medicine known as filgrastim. So filgrastim is a name of a medicine which is given to increase this WBC count. So medicine is having the word stim. Stim means stimulator. So this medicine is a stimulator. It's a granulocyte. GRA stands for granulocyte stimulator. So this medicine is granulocyte stimulator, right? So this medicine can be given to increase the WBC count. So this medicine is stimulator of granulocytes. Granulocytes are WBC, which I can use for the treatment of this condition. Now when the platelet count is less, I can use a medicine known as oprelvicin. So oprelvicin is a medicine. Oprelvicin is a medicine which is interleukin 11 analog. So this medicine will act like a interleukin 11, which is a stimulator of the platelets. So interleukin 11 analog, the drug name is oprelvicin. So oprelvicin, if you find out the name, this medicine name ends with the word kin. So it's a interleukin. So this medicine will act like a interleukin 11. So oprelvicin is used to increase the platelet count, and filgrastim is a drug which is given to increase the WBC count, the second side effect of anti-cancer drug. Now the third side effect of anti-cancer drug is tumor lysis syndrome. So third side effect of the medicine is tumor lysis syndrome. So in a patient of tumor lysis syndrome, patient will have excessive production of uric acid. Patient will have excessive production of uric acid. And please remember, for the tumor lysis syndrome prevention, so for prevention of tumor lysis syndrome, we can use a medicine known as allopurinol. So allopurinol is a medicine which I can use for the prevention of this syndrome. But if this question is asked to you, what is the treatment of tumor lysis syndrome? What is the treatment of tumor lysis syndrome? You can mark the medicine as resp-uricase. You can mark the medicine as a uricase enzyme. So uricase enzyme like resp-uricase and p-gluticase. So p-gluticase, resp-uricase are the medicines which I can use for the treatment of this tumor lysis syndrome. So prevention is by allopurinol, treatment is by resp-uricase and p-gluticase. Right? And we have one more drug over here which is very important drug for your exam. The drug name is methotrexate. Now how we can overcome the toxicity of methotrexate? So if the MCQ is asked to you, methotrexate toxicity. So methotrexate toxicity prevention. So prevention of methotrexate toxicity is done by a drug known as leucovorin. So leucovorin is the medicine. Leucovorin is a medicine which is also known as folinic acid, So this is the prevention of this methotrexate toxicity. But if the question is asked to you, what is the treatment of methotrexate toxicity? So treatment of methotrexate toxicity is forced alkaline diuresis. So forced alkaline diuresis is treatment of choice for methotrexate toxicity. So forced alkaline diuresis is treatment of choice for methotrexate toxicity. Prevention is done by the leucovorin. The last point is regarding the medicine known as cyclophosphamide. So we have the medicine like cyclophosphamide, and we have a one more drug like known as ifosfamide. So cyclophosphamide and ifosfamide are the two medicine. When given to a patient, these medicines can cause hemorrhagic cystitis. These medicines can result in hemorrhagic cystitis as a side effect. And because this medicine can cause hemorrhagic cystitis as a side effect, we have to give a medicine to prevent the side effect. So a drug which is given to prevent the side effect is known as Mesna. So Mesna is the name of a medicine which is given to prevent the hemorrhagic cystitis as a side effect of cyclophosphamide and ifosfamide. Now this is all about this topic number 18 for you. Now let's move on to topic number 19. So topic number 19. So let's move on to the next topic, that is endocrine. So if we talk about this topic, endocrine. So in endocrine, the diabetes mellitus, the medicines which are known as anti-diabetic drugs. So anti-diabetic drugs is an important topic in this endocrine session. So in anti-diabetics, we can divide the medicines in total 4 groups. We have total 4 types of anti-diabetic medicines. We have total 4 types of anti-diabetic medicine. First is known as insulin. Second is known as insulin secretagogues. Second group of medicine is known as insulin secretagogues. First is insulin. Second is insulin secretagogues. Third group of medicine is known as metformin. So this medicine can reduce insulin resistance. Medicine can reduce the insulin resistance. Medicine can reduce the insulin resistance. And number 4 medicine is the drug which can increase glucose elimination from the body. So the medicine which can increase glucose elimination from the body, so we call them anti-diabetic drugs. So anti-diabetic drugs are insulin. Second is insulin secretagogue. Third is the medicine which can reduce insulin resistance. And the fourth is medicine which can increase glucose elimination out of the body. Right? Now, as far as this insulins are concerned, this is not a very important topic for your exam. They generally don't ask the classification of insulin, but still I would like to mention a drug known as D-glutec. So we have a drug like D-glutec. We have the medicine like glargine. So insulin, glargine and D-glutec are 2 very long-acting insulins. So they are the long-acting insulins. So 2 long-acting insulins are insulin D-glutec and insulin glargine. So insulin glargine and D-glutec are 2 long-acting insulins we have. Now we have the medicines which are known as insulin secretagogues. So insulin secretagogues are the medicines which can lead to increased insulin secretion in the body. So medicines which can increase insulin secretion in the body. Number 1 group of medicine is known as GLP-1 analogs. So medicines are known as GLP-1 analog. The classical drug which belongs to this class is known as liraglutide. So liraglutide is the medicine which is GLP-1 analog. Now this medicine is not given by oral route. This medicine is always given by subcutaneous route. So the drug name is liraglutide. This is GLP-1 analog given by subcutaneous route. Now apart from diabetes, this medicine is also approved for the treatment of obesity. This medicine is also approved for the treatment of obesity. The second MCQ is this medicine will not cause hypoglycemia as a side effect. This medicine will not cause hypoglycemia as a side effect. And one of the important side effects of this medicine is pancreatitis. So liraglutide is a medicine. One of the important side effects is pancreatitis. Advantage is this medicine will not cause hypoglycemia, and apart from diabetes, this medicine is anti-obesity drug. It's one of the leading drug nowadays which we use for obesity. So we call them GLP-1 analogs. Now after the GLP-1 analogs, we have a group of medicines. We call them DPP-4 inhibitors. So medicines which are known as DPP4 inhibitors. Now the drugs which are DPP4 inhibitors, all these medicines ends with the word gliptin. So all the medicines ends with the word gliptin. We call them DPP4 inhibitors. So when we block this DPP4 enzyme, they will increase the level of GLP-1 in the body. So by inhibiting this enzyme, DPP4 enzyme, medicines can increase the level of GLP-1 in the body. So we call them gliptins. Now any drug which ends with the word gliptin is given by the oral route. So these medicines are given by the oral route. And we have a drug over here. The drug name is linagliptin. So we have a medicine over here. The drug name is linagliptin. Now please remember, linagliptin is a drug which starts with the letter Li. Now because this medicine starts with the alphabet Li, this medicine is purely metabolized by the liver. So this medicine is purely metabolized by the liver. So this is the drug which is safe to use in patients of CKD. So in patients of CKD, this linagliptin is a medicine which is safe to use. So linagliptin is a medicine which is safe to use in patients of CKD. This is important for your exam to know about the linagliptin. Now we have the medicine metformin. Now metformin is a drug. It's the best medicine for the treatment of diabetes mellitus 2. And when we give metformin to a patient, the important side effect of metformin are this medicine can cause vitamin B12 deficiency, and this medicine can result in lactic acidosis as a side effect. So medicine can cause vitamin B12 deficiency, can result in lactic acidosis as a side effect. Now the medicines which can increase glucose elimination from the body. So the medicines which can increase glucose elimination from the body, these medicines are known as SGLT2 inhibitors. So the drugs which can increase glucose elimination out of your body, we call them SGLT2 inhibitor. So any medicine that ends with the word gliflozin, any medicine that ends with the word gliflozin belongs to this class of SGLT2 inhibitor. One example is like canagliflozin. One more example is like dapagliflozin. So canagliflozin, dapagliflozin, empagliflozin, all these are examples of SGLT2 inhibitors. Now whenever we give these medicines to a patient, one of the side effect of this medicine is increased risk of UTI. So these medicines can increase the risk of UTI. These medicines can result in increased risk of vulvovaginitis in females. So in females, these medicines can increase the risk of vulvovaginitis, can result in increased UTIs. In male patient, the medicine can cause Fournier's gangrene. So in male patient, medicine can cause Fournier's gangrene. In female patient, medicines can cause vulvovaginitis and can also increase the risk of UTI. So these are the important class of antidiabetics which can be asked in your 2023 exam. So 2023, they are more fond of asking the new antidiabetics. So I have covered most of the new antidiabetics for you in this table. So if you just revise this table, most of the MCQs might be covered for your exam. Now after this diabetes, the second topic in endocrine that can be asked for your exam is hyperthyroidism. So the medicines which are given for the treatment of hyperthyroidism. So which medicines are given for the treatment of hyperthyroidism? So the drugs which are given for hyperthyroidism, please remember, we have three group of medicines total. The medicines which are given for hyperthyroidism, the one medicine that will reduce the hormone synthesis. The first group of medicine is the drugs which can reduce the hormone synthesis. So this is the most important class of medicines that will reduce the thyroid hormone synthesis in the body. So the medicines which will reduce the thyroid hormone synthesis. The other group of medicine is the drugs which can inhibit the thyroid hormone release from the body. And the last group of medicine is the medicines which will block the conversion of T4 to T3. Medicines which will block the conversion of T4 to T3. So we have total three classes of drugs which are given for hyperthyroidism. So the medicines which are hormone synthesis inhibitors. So the drugs which are hormone synthesis inhibitor, we're going to start first. So these medicines are total two. So we have a drug known as carbimazole. We have a medicine, we call it carbimazole. And the second drug which belongs to this class is known as propylthiouracil. So we have a medicine, propylthiouracil, and we have a drug, carbimazole. So propylthiouracil is known as PTU. Carbimazole is a drug. It is drug of choice for maintenance treatment of hyperthyroidism. So maintenance treatment of Graves' disease. Hyperthyroidism is also known as Graves' disease. So maintenance treatment of Graves' disease is carbimazole. Second point, this medicine is also drug of choice for hyperthyroidism in pregnancy. Medicine is drug of choice for hyperthyroidism in pregnancy. typically in second and third trimester. So in second and third trimester, this medicine can be given as the drug of choice for second and third trimester. Now, please remember this medicine is contraindicated in first trimester. So medicine is contraindicated in first trimester of pregnancy. Otherwise, the baby is born with the problem of aplasia cutis. So baby can have the problem, we call it aplasia cutis. So in first trimester, medicine is contraindicated, but in second and third trimester, carbimazole is a drug of choice, and it is also considered as drug of choice for overall maintenance treatment of Graves' disease in non-pregnant patients. Now, the important side effect of this medicine is agranulocytosis. So one of the important side effect of the medicine is agranulocytosis as a side effect. Now, if we talk about propylthiouracil, now this is a drug of choice for thyrotoxicosis. So this medicine is drug of choice for thyrotoxicosis, as well as this medicine is drug of choice for hyperthyroidism in first trimester of pregnancy. So in first trimester of pregnancy, this is a drug of choice. In first trimester, it is a drug of choice, and it is also a drug of choice for thyrotoxicosis. And one of the important side effect of propylthiouracil is hepatotoxicity. So hepatotoxicity is one of the side effect of propylthiouracil. So these are the two important drugs which I think can be asked in your exam, right? And the medicines which inhibit the hormone release, these medicines are known as iodides. So iodides are the drugs like sodium iodide, potassium iodide, Lugol's iodine. So all these medicines are thyroid hormone release inhibitors. So we call them iodides. So these medicines are given for the treatment of hyperthyroidism. Now let's talk about the topic number 21. So after this hyperthyroidism as well as the diabetes, the next topic is SERM. So third important topic for your exam is SERM. So what is the full form of SERM? The full form of SERM is selective estrogen receptor modulators. So we call them selective estrogen receptor modulators. So medicines are selective estrogen receptor modulator drugs. So all these medicines ends with the word fen. All the drugs ends with the word fen, like we have a drug tamoxifen. So tamoxifen is a medicine. This medicine is given for the treatment as well as prevention. Medicine is given for treatment as well as prevention of breast cancer. So this medicine is given for treatment as well as prevention of breast cancer. So treatment and prevention of breast cancer, I will use the medicine tamoxifen. But when this medicine is given to a patient, the important side effect of tamoxifen are this medicine can cause cataract. So this medicine can cause cataract as a side effect. This medicine can result in endometrial carcinoma. Medicine can result in endometrial carcinoma. This medicine can result in thromboembolism. So three basic problems with this medicine is medicine can result in cataract, medicine can result in endometrial carcinoma, medicine can result in thromboembolism as a side effect. The drug name is tamoxifen. Now after the tamoxifen, the next drug here is raloxifene. So if we talk about this medicine raloxifene, now raloxifene is a medicine which is estrogen receptor analog. We can use this medicine for the treatment of postmenopausal osteoporosis. So this medicine is given for postmenopausal osteoporosis treatment. So I can use raloxifene for postmenopausal osteoporosis, but this medicine will not cause endometrial carcinoma. This medicine will not cause endometrial carcinoma like tamoxifen. If we talk about the third medicine of this group, the third medicine is clomiphene. So third medicine which belong to this class is clomiphene. Now this medicine is given for ovulation purpose. This medicine is given for the purpose of ovulation, and the important side effect of this medicine is multiple ovulation. So this medicine can result in multiple ovulation and hence the multiple pregnancy. So clomiphene is given for ovulation and hence multiple ovulations, right? And the fourth medicine that belong to this class is ormelixifene. So we have a drug, the drug name is ormelixifene. Now ormelixifene is a drug which is also known as Saheli. So this medicine is also known as Chaya. So Saheli and Chaya, the drug name is ormelixifene. This medicine is used as an oral contraceptive pill. So ormelixifene is a medicine. This is used as an oral contraceptive pill. Medicines names are Chaya and Saheli. So we have a drug SERM. So all the medicines ends with the word fen. So we call them female drugs. So tamoxifen is having the word MO. This is given for the mammals problem or the mammary gland problem. So MO stands for mammary gland problem. Now raloxifene is having the word LO. Now this is given for the locomotor problem. Locomotor means the bones problem. Right? So it was given for locomotor problem. Tamoxifen is given for mammary gland problem. Now clomiphene is a one that will make the multiple clones in the word. So this medicine is given to make the multiple clones. So multiple clones means multiple ovulation. So this medicine is given to make multiple clones in this word. So medicine is given for multiple ovulation. And ormelixivin starts with O, it is given as OCP. So ormelixifin starts with O, it is given for OCP. So raloxifene for locomotor, tamoxifen for memory problem, and clomiphene is to make clones, and O is for OCP. This is all about the topic, that is SERM. But guys, here one thing I would like to mention, if the MCQ is asked to you, what is the drug of choice for ovulation? What is the drug of choice for ovulation in a PCOD female? So drug of choice for ovulation in a PCOD female, you people are supposed to mark this medicine letrozole. So letrozole is a drug which is overall the best medicine for ovulation in PCOD female. So what is letrozole? Letrozole is an aromatase enzyme inhibitor. So this medicine is aromatase enzyme inhibitor, and I can use this medicine for the treatment of PCOD. So treatment of ovulation, treatment of infertility in PCOD, I can use aromatase enzyme inhibitor. The drug name is letrozole. This is all about this topic number 21. Now after this topic number 21, let's move on to the next topic. So next topic is topic number 22, that is on antimicrobial. Now in this antimicrobial, the first topic is antiviral drugs. So if we talk about the antiviral drugs, now HIV drugs can be asked in your exam. So HIV drugs are important for this year exam because there is no COVID-19 now. So HIV drugs are important. Now for the treatment of HIV drugs, guys, please remember we have total 4 group of medicines that we can use. So the treatment of HIV, 4 group of medicines are used. One is known as NRTI. So NRTIs are the nucleoside reverse transcriptase inhibitors. So medicines are known as nucleoside reverse transcriptase inhibitors. So we call them nucleoside reverse transcriptase inhibitor. We call them NRTI. Now we have the NNRTIs. So we call them non-nucleosides. We call them non-nucleosides reverse transcriptase inhibitor. So nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor. Now we have a third medicine, we call it integrase enzyme inhibitors. So we call them integrase enzyme inhibitor. And the fourth group of medicine is known as protease enzyme inhibitors. So we have a fourth group of medicine, we call them protease enzyme inhibitors. So nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase inhibitor, integrase inhibitor, and the protease inhibitor. Now nucleoside reverse transcriptase inhibitors are the medicines which always ends with the word vudine. And for your exam, one drug is important, that is lamivudine. So we have a drug like lamivudine, we have a medicine like ziduvudine. So we have 2 examples of the medicines like lamivudine and ziduvudine. Now NNRTIs are the medicines which ends with the drug, most of the medicines ends with the drug virin. So most of these medicines ends with the word virin, and for your exam 2 medicines are important. One is known as efavirin. So medicine is known as efavirins. One more drug which has a different name, the drug name is nevirapine. So nevirapine is one more example of NNRTIs. Now integrase inhibitors are the medicines which ends with the word tigravir. So all these medicines ends with the word tigravir, and for your examination point of view, dolutegravir. Dolutegravir is a drug that is important. Now for the protease inhibitor, all the medicines ends with the word navir. So all the medicines ends with the word navir. One of the example of the drug is ritonavir. So one of the example of the medicine is ritonavir, which is protease inhibitor. So protease inhibitors ends with the word navir. Integrase inhibitors ends with the word tigravir. NNRTIs are the medicines which ends with the word virin, and NRTIs are the medicines which ends with the word vudine. Right? So these are the different classes of drugs that I can use for the treatment of HIV. Now what is the treatment of HIV that we use nowadays? So nowadays we give a combination of 3 medicines. So we can give the combination of 3 medicine, T plus L plus D. Right? So here the L stands for lamivudine. So L stands for lamivudine and D stands for dolutegravir. So these days we give the combination like dolutegravir, lamivudine, and T stands for our unique medicine. We call it tenofovir. So tenofovir is a drug which is exactly not a NRTI. We call it nucleotide. It's a totally different class, nucleotide reverse transcriptase inhibitor. So we have a medicine tenofovir, which is a nucleotide reverse transcriptase inhibitor. L stands for lamivudine, D stands for dolutegravir. Now this combination we use in all patients of HIV. So in all patients of HIV, we use this triple regimen for the treatment, right? So this is for the HIV drugs. This is all about the question number 22. We talk about antiviral drugs. Now recently there is a small outbreak of swine flu. So few days back in Delhi there was a short outbreak of swine flu. So most of the time swine flu is H1N1, but this time this was H3N2. So swine flu H1N1, H3N2, but please remember the drug of choice you people have to mark is oseltamivir. So oseltamivir is a medicine which is a drug inhibitor of neuraminidase enzyme. So this medicine is neuraminidase enzyme inhibitor. And by inhibiting the neuraminidase enzyme, oseltamivir is a drug given in a dose of 75 milligram twice daily for 5 days. So this medicine is given in a dose of 75 milligram twice daily for 5 days. This is treatment of swine flu. This time this was H3N2. This is all about antiviral. This is topic number 22 for you. Now let's talk about topic number 23. Now topic number 23 is based on antifungal drugs. So if we talk about the important drugs in antifungal, so I would just like to highlight two groups for you people, antifungal drug. One is known as liposomal amphotericin B. So one drug is liposomal amphotericin B. We also call it LAMB. So liposomal amphotericin B. Now this medicine is drug of choice for mucormycosis. So this medicine is drug of choice for mucormycosis. Now mucormycosis is also known as black fungus. So it's a drug of choice for black fungus, mucormycosis. And this medicine is also considered as drug of choice for cryptococcal meningitis. So in your December exam, this cryptococcal meningitis was asked. So in your December exam, cryptococcal meningitis, which is seen in HIV patient, this is asked what is the best medicine for cryptococcal meningitis. So liposomal amphotericin B. So liposomal amphotericin B is drug of choice for black fungus, drug of choice for cryptococcal meningitis, and the same medicine is also drug of choice for visceral leishmaniasis. So it's a drug of choice for visceral leishmaniasis, which is also known as Kala Azar. So this medicine is drug of choice for Kala. Kala means Kala fungus, black fungus, and also the drug of choice for Kala Azar. It's also a drug of choice for cryptococcal meningitis. Now if we talk about the important side effect of liposomal amphotericin B. So this medicine can cause nephrotoxicity. So one of the important side effects of this medicine is nephrotoxicity. Now as a result of nephrotoxicity, the patient will lose the magnesium and the potassium ion. Patient will lose magnesium and the potassium ion because the kidney is damaged by the drug. Now when the ions are lost from the body, when this medicine will cause loss of ions from the body, this medicine can result in neurotoxicity, ototoxicity as a side effect. So when you lose the ions from the body, your nerves cannot work properly. So this medicine will cause nephrotoxicity, can result in loss of ions. Now, as a result of loss of ions, this medicine can interfere with the nerve conduction, can result in neurotoxicity and ototoxicity as a side effect. So this is for the liposomal amphotericin B. 3 indications: drug of choice for mucormycosis, drug of choice for cryptococcal meningitis, drug of choice for visceral leishmaniasis. Now let's talk about the second group of medicine. Now the second group of medicine which is important here is known as azoles. So medicines are known as azoles. Now if we talk about these medicines, azoles, the first medicine is fluconazole. So fluconazole is a medicine. It's a drug of choice for candidiasis. So this medicine is drug of choice for candidiasis. Now we have one more medicine over here. The drug name is itraconazole. Itraconazole, and this medicine is one of the leading drug for the treatment of tinea infection. It is one of the leading drugs that is given for the treatment of tinea infection. Now tinea infection is also known as dermatophyte infection. It is one of the leading drug for tinea or the dermatophyte infection. We call it itraconazole. Now we have a medicine over here, we call it voriconazole. Now voriconazole is a drug of choice for invasive aspergillosis. So this medicine is drug of choice for invasive aspergillosis. So invasive aspergillosis, we have a drug known as voriconazole. So fluconazole for candidiasis, itraconazole for tinea infection, derma infection, skin infection. Voriconazole, drug of choice for invasive aspergillosis. We have a drug known as posaconazole. Now, posaconazole is a medicine which is particularly given for the treatment of mucormycosis as a second drug of choice. So, for mucormycosis, second drug of choice is posaconazole. So, second drug of choice for mucormycosis is posaconazole. So, this is all about the important antifungal drugs for you, which I think can be asked in your exam. These are the antifungals. Now, after the antifungals, let's move on to the 24th topic. The 24th topic which can be asked in your exam is an anti-malarial drugs. So, treatment of malaria. So, anti-malarial drugs, or we can say the treatment of malaria. So, in this treatment of malaria, the most important drug for your exam is primaquine. Now, please remember what is the role of primaquine. So primaquine is the most important drug for you. Now, if we talk about primaquine, now this primaquine is given in PYVX treatment. This medicine is given in PYVX treatment as a drug of choice for relapse. So this medicine is given in PYVX treatment to control the relapse. So primaquine is a medicine. This medicine is given in treatment of PYVX as a best medicine to control the relapse. And this medicine is given to control the relapse for 14 days. So drug is given for 14 days. Now what is the role of this medicine in P. falciparum? So in patients of P. falciparum, this medicine is given to control the transmission of falciparum. So this medicine is drug of choice to control the transmission of P. falciparum. So to control the transmission of P. falciparum, this medicine will kill its gametes. We call it gametocidal drug. So in P. falciparum, this medicine is given as a gametocidal drug, and the very important point are its contraindication. So primaquine contraindication is asked every alternate year. So every alternate year they ask the primaquine contraindication. So primaquine has two contraindication. Number one, like Dr. Manu Garg has already mentioned. Thanks Dr. Manu Garg, you have helped me out. So pregnancy. So pregnancy is first contraindication. Second is G6PD deficiency. So this medicine is contraindicated in pregnancy and G6PD deficiency. So these are the two important contraindication of primaquine, and this is the most important anti-malarial drug for your exam. Second, they will ask you the malaria prophylaxis. So what is the malaria prophylaxis? So they can ask you the malaria prophylaxis. So please remember, if we talk about the malaria prophylaxis, so any visitor who is coming to India, so if any visitor coming to India for less than 6 weeks, any visitor coming to India for less than 6 weeks, this patient will take doxycycline. So doxycycline is a drug of choice for malaria prophylaxis for any visitor coming to India for less than 6 weeks. But if the visitor is pregnant lady, if the visitor is a pregnant lady or a child who is less than 7 to 8 years of age, if visitor is a pregnant lady or a child who is less than 7 to 8 years of age, instead of giving doxycycline, so doxycycline is contraindicated, so here we prefer to give proguanil. So proguanil is a medicine. Proguanil is a medicine which is given for patients who are coming to India for less than 6 weeks. Now the patients who are coming to India for more than 6 weeks, so patients who are coming to India for more than 6 weeks, so these patients will get mefloquine. So mefloquine is a drug which is given as a best medicine for prophylaxis of malaria for the patients coming to India for more than 6 weeks. Right? So the medicine is mefloquine. Now mefloquine is a drug that this medicine can cause an important side effect of neuropsychiatric symptoms. So this medicine can cause neuropsychiatric symptoms as a side effect. So medicine can cause neuropsychiatric symptoms as a side effect. Now because this medicine can cause neuropsychiatric symptoms as a side effect, this medicine is contraindicated. This medicine is contraindicated in those patients who are involved in critical works. So any patient who is involved in critical work, this medicine is contraindicated. Like this medicine should not be given to electricians. This medicine should not be given to pilots. So medicine should not be given to electrician and pilots, otherwise they will have this problem during their work. This is not acceptable. This is for the malaria prophylaxis. Now the third question they can ask you in malaria is the treatment of complicated malaria or cerebral malaria. So treatment of complicated or cerebral malaria. So treatment of complicated or cerebral malaria, which is also known as black water fever. This is also known as black water fever. So for black water fever, cerebral malaria, complicated malaria, anyone can answer what is the drug of choice? So what is the drug of choice for cerebral and complicated malaria? Anyone would like to answer? Till the time I will have the water. So drug of choice for complicated and cerebral malaria is, Dr. Manu Garg has given the correct answer. It's artesunate. So artesunate is the best medicine to be given over here. If artesunate is not given in MCQ, if artesunate is not given in MCQ, you can mark artemether or arteether. So artemether and arteether can also be marked as a best medicine. If they are also not given in MCQ, the fourth medicine you will mark is quinine. So you will follow this sequence for the cerebral malaria, complicated malaria. Artesunate is a drug of choice, followed by artemether, arteether, and the quinine. So this is all about the topic malaria or the anti-malarial drug, topic number 24. Now let's move on to topic number 25. Now topic number 25 is based on the mycobacterial drugs. So medicines which are given for mycobacteria. So medicines which are given for mycobacteria, here you have two bacteria. One is tuberculosis, second is leprosy. So guys, you people have to mug up the leprosy regimens. So in leprosy, they mostly ask you the regimen. So regimen of leprosy is important, right? So always you have to give the three medicines. You must be knowing the dapsone, clofazimine, and rifampicin. So leprosy regimens are important. This you will remug up from your derma class. So in derma, this topic must have been covered. The regimens for the leprosy is important for your exam. Now if we talk about tuberculosis, in tuberculosis, the four medicines you people must be knowing. The names of the fourth medicine you must be knowing. One is known as H, second is R, third is Z, and the fourth is E. So nowadays we give H, R, Z, E, the four medicines as a first line drugs. Now streptomycin no longer be a part of this first line drug. So we have H, R, Z, E. Now please remember, all these medicines are cell wall inhibitors. All these medicines are cell wall inhibitors except rifampicin. Except rifampicin, which is not a cell wall inhibitor. Rather, this medicine is RNA polymerase inhibitor. So this medicine is RNA polymerase inhibitor. It is not the cell wall inhibitor. First point. Now after the mechanism of action, I will say medicine. If we talk about the medicine's side effects. So what are the side effects of isoniazid? So if we talk about the side effects of isoniazid, this medicine can cause hepatotoxicity. Even rifampicin can cause hepatotoxicity. Even the pyrazinamide is a medicine which can cause hepatotoxicity. So three medicines can cause hepatotoxicity as a side effect. Now apart from that, this isoniazid is a drug. This medicine can result in neuropathy as a side effect. So this medicine can result in neuropathy as a side effect. Now this neuropathy is due to the vitamin B6 deficiency. So this medicine can cause vitamin B6 deficiency, can result in neuropathy as a side effect. Hepatotoxicity, neuropathy, and medicine can result in SLE-like symptoms. So this medicine can result in SLE-like symptoms. Talk about rifampicin. Rifampicin can cause hepatotoxicity. This medicine can result in very important side effect, hypersensitivity reaction. Now, as a result of hypersensitivity reaction, please remember this medicine can result in myelosuppression. So bone marrow suppression is an important limitation of rifampicin. It can cause hypersensitivity reaction. Number 3, this medicine can result in orange discoloration of body secretion. Can result in orange discoloration of the body secretion, that is rifampicin. Now pyrazinamide is a drug which can cause hepatotoxicity. This medicine can result in hyperuricemia. So can result in hyperuricemia also. If we talk about ethambutol, ethambutol is a drug which can cause hyperuricemia as a side effect. Plus, this medicine can also result in neurotoxicity. Now, as a result of neurotoxicity, patient can develop optic neuritis. So, this medicine can damage the retinal nerves, can result in optic neuritis, result in red-green blindness as a side effect. Now, all these medicines are bactericidal. All these medicines are bactericidal except ethambutol, which is bacteriostatic. So, ethambutol is the only drug which is bacteriostatic. Rest of the medicines belong to this class are bactericidal. Right? Now, apart from tuberculosis, rifampicin is a drug. Rifampicin is a medicine. Apart from tuberculosis, this medicine is also given for leprosy. Rifampicin is also given for the treatment of MRSA. Rifampicin is also given for the treatment of MRSA, methicillin-resistant Staph aureus. So these are some other indications where I can use this rifampicin as a drug. Now, rifampicin, just like rifampicin, we have a drug known as rifabutin. So just like rifampicin, we have a drug rifabutin. So rifabutin is one more drug. Like rifampicin will cause orange discoloration, rifabutin is just like a rifampicin. This medicine can cause yellow discoloration. This medicine can cause yellow discoloration. This medicine can result in uveitis as a side effect. Medicine can cause yellow discoloration of body secretions. This medicine can cause uveitis as a side effect. And rifabutin is the drug can result in serotonin syndrome. Can result in serotonin syndrome as a side effect. The drug name is rifabutin. Now we have two new drugs for tuberculosis. One is known as delamanid. So one drug is known as delamanid. Second drug is known as bedaquiline. So bedaquiline and delamanid are the two new drugs for tuberculosis. Now out of that, delamanid is a drug which is cell wall inhibitor. And in mycobacterial cell wall, we have the presence of mycolic acid. So this medicine is mycolic acid synthesis inhibitor. So delamanid is mycolic acid synthesis inhibitor, and we have a drug bedaquiline. Now bedaquiline is a drug which is ATP synthase inhibitor. So this medicine is ATP synthase inhibitor, and both medicines are given for the treatment of MDR and the XDR tuberculosis. So both medicines are given for the treatment of MDR and the XDR tuberculosis. So bedaquiline is ATP synthase inhibitor, delamanid is cell wall inhibitor. So both medicines are new drugs for tuberculosis given for MDR and the XDR tuberculosis. Right? So this is all about a brief introduction of the TB drugs, topic number 25. Now after that, I will just tell you some names of the topics which you can read by yourself, like the topic number 26. Now topic number 26 is based on the antibiotics. So in antibiotics, you people will be asked to tell the classification. So classification of antibiotic is important for your exam. So classification of antibiotic based on their mechanism of action. So you should be knowing which medicines are cell wall inhibitors, which medicines are cell membrane inhibitors. You should be knowing which medicines are protein synthesis inhibitors, medicines which are folic acid pathway inhibitors, and the medicines which act on the nuclear material. So these are the 5 groups of antibiotics we have. The classification of antibiotics based on mechanism of action. We have cell wall inhibitors, cell membrane inhibitors, protein synthesis inhibitor, folic acid pathway inhibitors, and the medicines which act on the nuclear material. Like if I say which medicines are cell wall inhibitor, one classical example is like all penicillins. So penicillins are cell wall inhibitors, cephalosporins are cell wall inhibitors. Right? Similarly, we have a drug vancomycin. Vancomycin is an antibiotic, it's a cell wall inhibitor. Similarly, important drugs in protein synthesis inhibitors are macrolides. So macrolides like azithromycin, clarithromycin. Now these medicines will act on 50S ribosome. Medicines will act on 50S ribosome, inhibit the protein synthesis. Similarly, we have a drug known as doxycycline. So doxycycline is a tetracycline. This medicine will act on 30S ribosome. So doxycycline will act on 30S ribosome. Macrolides like erythromycin, clarithromycin, azithromycin, they will act on 50S ribosome. Now we have a drug which will act on the nuclear material. So the drugs which will act on the nuclear material, one classical example is fluoroquinolones. So we have the medicines like fluoroquinolones. Now fluoroquinolones are the medicines which are the DNA gyrase inhibitors. So these medicines are DNA gyrase inhibitors. So these medicines mechanism of action can also be asked. Right, so cell wall inhibitors are like penicillins, cephalosporin, vancomycin. Protein synthesis inhibitors are like macrolide, which will act on 50S ribosome. Doxycycline will act on 30S ribosome. Medicines which act on the nuclear material, like all these medicines are having the word fluoxacin in their name. So fluoroquinolones are the medicines which have the word fluoxacin in their name. These medicines are DNA gyrase inhibitors. So these are the some examples of the antibiotics mechanism of action they can ask you. Now, if we talk about topic number 27, now in topic number 27, they can ask you the antibiotics indications. So they can ask you, they can give you the any bacteria, and when they give you the bacteria, they will ask you the drug of choice for that bacteria. So this is a bit tricky topic because they can give you any bacteria and ask you the drug of choice for that. There's a huge list of bacteria and their drug of choice. So you people have to mug up that list of bacteria and their drug of choice. Let's take an example. Now, recently in your exams, they have asked the bacteria like Legionella. So, when the patient is suffering from Legionella, so the patient is suffering from this infection, we call it Legionella. So, Legionella infection, the drug of choice is azithromycin. So, azithromycin is a drug of choice for Legionella infection. Now, in one of your exam, they have asked you the drug of choice for rat bite fever. So, rat bite fever. Please remember the drug of choice is penicillin G. So penicillin G, drug of choice for rat bite fever. Now syphilis is their hot favorite topic. Syphilis treatment is their hot favorite topic. So you have to discuss the detailed treatment. Detailed treatment of syphilis you should be knowing. So please read this detailed treatment of syphilis from your derma class. Right? So detailed treatment of syphilis, the drug of choice for syphilis is again penicillin G. So drug of choice for syphilis is again penicillin G that you should be knowing. Now they can ask you which antibiotic we can use for surgical prophylaxis. So whenever the patient has to undergo surgery, so which medicine or which antibiotic is the most commonly used antibiotic that I can use for surgical prophylaxis? So for surgical prophylaxis, most commonly used antibiotic is cefazolin. So cefazolin is the most commonly used antibiotic for surgical prophylaxis that you should be knowing. Number 5, they can ask you what is the drug of choice for MRSA. So please remember the drug of choice for MRSA is vancomycin. So vancomycin is a medicine which is a drug of choice for MRSA. Similarly, they can ask you what is the drug of choice for Clostridium difficile infection. So Clostridium difficile infection. So Clostridium difficile is the one which can result in pseudomembranous colitis. So which can result in pseudomembranous colitis as a side effect. So the best medicine here is fidaxomicin. So fidaxomicin is the best medicine to be marked. But if it is not given in MCQ, you can go for vancomycin. So fidaxomicin is the best medicine followed by the vancomycin. Even if it is not given, you can go for metronidazole. So fidaxomicin, vancomycin, metronidazole you can mark as a drug of choice. They can be asked what is the drug of choice for bacterial vaginosis. What is the drug of choice for bacterial vaginosis? What is the drug of choice for strawberry cervix? What is the drug of choice for strawberry cervix? So all this we give metronidazole. So in this way you have to make a list of various infections and you have to mug up the drug of choice for all these types of infection. Like recently they have asked you in one of your NEET exam, they have asked you the indication of, they have given the name of a bacteria that is Bordetella pertussis. So what is the drug of choice for Bordetella pertussis? So Bordetella pertussis. So Bordetella pertussis can cause whooping cough. So this can cause whooping cough as a side effect. So what is a whooping cough is a disease. So what is the drug of choice for whooping cough? So drug of choice for whooping cough is azithromycin. So guys, this is important because they have recently asked in one of your exam. So azithromycin, whooping cough we can give. Now if they will ask you what is the treatment of community acquired pneumonia. So community acquired pneumonia. So community acquired pneumonia, or if the patient is having skin infection. Patient will get skin infection after the patient has got skin infection after the animal bite. So if the patient will get skin infection after the animal bite. So skin infection after the animal bite, or patient is having community acquired pneumonia, you will mark amoxiclav. So amoxiclav is the best medicine you will mark. So these questions are asked in your recent exams. In your recent exam, they have asked all these questions. So in this way, you can make a list of various bacteria and you can mark the drug of choice for these kind of bacteria and the infections. So this is all about the topic number 27 for you. Now let's talk about topic number 28. So if we talk about topic number 28, this is based on central nervous system. So we have the anti-epileptic drugs. So we have the topic like anti-epileptic drugs. Now if we talk about anti-epileptic drugs, now in your recent exams, I don't know why, but they are not asking questions from CNS. So CNS pe, anti-epileptics pe, they are not asking question. So this is one of the topic which you can, if you want to leave, you can leave, right? So anti-epileptics mein medicines which are important for your exam are phenytoin. Second is sodium valproate. So sodium valproate is important. Phenytoin can be asked. Topiramate is a third medicine which they can ask. The fourth medicine is lamotrigine. So lamotrigine is a fourth medicine. And the fifth medicine is carbamazepine. So these are the 5 medicines they can ask in your exam from this topic of anti-epileptics, right? Like recently they have asked regarding phenytoin. Phenytoin is a drug. This medicine can cause vitamin D deficiency. This medicine can cause vitamin K deficiency. And this medicine can also cause vitamin B9 deficiency. So vitamin B9 is a folic acid deficiency. So this medicine can cause vitamin D, vitamin K, folic acid deficiency. This medicine can result in gum hypertrophy as a side effect. Can result in gum hypertrophy as a side effect. If we talk about valproate, valproate is a drug which can cause hepatotoxicity as a side effect. This medicine can result in hyperammonemia. This medicine can result in tremors as a side effect. This medicine can result in PCOD as a side effect. Now, topiramate is a drug which can cause weight loss. So, Dr. Manu Garg is firing like anything. So, medicine can cause weight loss as a side effect. Topiramate can cause metabolic acidosis as a side effect. This medicine can result in formation of renal stone as a side effect. Now, lamotrigine is a medicine which can cause hypersensitivity reaction. Now, carbamazepine is a medicine. This medicine can cause water retention. This medicine can cause water retention, which resemble a disease known as SIADH. Now, due to this water retention, this medicine can result in hyponatremia. So, medicine can cause water retention. Due to water retention, sodium get diluted. So, medicine will cause hyponatremia as a side effect, carbamazepine. Now, carbamazepine is a drug. This medicine can result in agranulocytosis as a side effect. So, carbamazepine can result in agranulocytosis as a side effect. So, in this way, you can read about these 5 types of anti-epileptics. So, most of the time, questions are asked on these 5 anti-epileptics only. Right? So, question number 28, based on anti-epileptics, which you can read further in detail. Now, let's move on to question number 29. So, question number 29 will be asked on drug de-addiction. Now, guys, one MCQ is confirmed. One MCQ is confirmed from this topic of drug de-addiction. So, every year they can be asked to talk about the opioid de-addiction treatment, alcohol de-addiction treatment, as well as de-addiction treatment of the nicotine. So, nicotine de-addiction, alcohol de-addiction, opioid de-addiction. So, this topic is very important for your exam. So, opioid de-addiction, alcohol, and nicotine. So, what all drugs are useful? This can be asked. And now, in your recent exams, they've asked a drug for opioid toxicity. So, which medicine we can use for opioid toxicity? So, for opioid toxicity, we use a medicine naloxone. So, I will share you one slide with you where I have covered all these 3 medicines in detail. So, in one table, you will come to know the various answers of the question. Like this year, in one of your exam, they have asked the treatment of opioid toxicity. The answer is naloxone. Now, for nicotine, we have the medicines like nicotine itself is used. So, nicotine can be used in the form of skin patch. Nicotine can be used in the form of skin patch for nicotine de-addiction. We have one more medicine. The drug name is varenicline. So, varenicline is one more drug that is given for nicotine de-addiction. So, this varenicline is having the word nic, N-I-C. So from this NIC, you can find out it's a nicotine de-addiction drug. Similarly, we have one more medicine, we call it bupropion. So bupropion, varenicline, nicotine can be given for nicotine de-addiction. Similarly, for alcohol, the medicine name is naltrexone. So naltrexone is a medicine which is given for de-addiction. So naltrexone is the best medicine for nicotine de-addiction of alcohol de-addiction. The drug is naltrexone. So similarly, I will share a table with you where I can discuss, where I will give you this drug de-addiction drugs. Now the last topic, this is topic number 30. Now topic number 30 is based on antidepressant medicines. So antidepressant medicines can be asked, and particularly the topic is SSRI. So SSRIs, which are the best medicines for the treatment of depression. So these medicines can be asked. So please remember, all SSRIs are safe in pregnancy. All SSRIs are safe in pregnancy except one drug, that is paroxetine. So all SSRIs are safe in pregnancy except the drug paroxetine, which is unsafe. Now please remember, all SSRIs are the long-acting drugs. All SSRIs are the long-acting medicines except paroxetine and fluvoxamine. So all SSRIs are the long-acting medicines except paroxetine and the fluvoxamine medicines. Now, if we talk about the side effects of SSRI medicines, right? If we talk about side effects of SSRIs, you can remember by this mnemonic, that is GO SSRIs. So mnemonic is GO SSRI. So GO stands for GIT side effect. So this medicine can cause most common side effect as GIT side effect. Now this medicine can also result in osteoporosis. Medicines can result in osteoporosis as a side effect. Medicine can result in serotonin syndrome. Medicine can result in serotonin syndrome as a side effect. These medicines can cause sexual dysfunction. Medicine can result in sexual dysfunction as a side effect. Now, in sexual dysfunction, these medicines can be associated with delayed ejaculation. So these medicines can cause delayed ejaculation as a side effect, particularly maximally seen with the drug known as paroxetine. It is maximally seen with the medicine known as paroxetine. Now these medicines can cause recurrence of symptoms. These medicines can cause recurrence of symptoms on discontinuation. So when you discontinue some of these medicines like paroxetine, patient can develop the discontinuation syndrome. So these are the some important side effects of SSRI that we have covered over here. Now this is what I think can be asked in your exam. One more drug, one bonus point, topic number 31 is regarding a antipsychotic clozapine. So clozapine, guys, please remember, one of its important side effect is agranulocytosis. So clozapine is a medicine. It's a drug of choice for refractory cases of schizophrenia. It's a drug of choice for refractory cases of schizophrenia. And this medicine can cause agranulocytosis as a side effect. Plus this medicine can result in cialorrhea. This medicine can result in cialorrhea as a side effect. One more bonus drug for you people is lithium. So please read lithium and clozapine by yourself. So please remember, lithium half-life is 24 hours. Lithium half-life is 24 hours, and treatment of choice for its toxicity. Treatment of choice for lithium toxicity is hemodialysis. Hemodialysis is the treatment of choice for lithium toxicity. So two medicines I have given you for the bonus. So please read these two medicines by yourself, because these two are also very important for your exam, but will be covered in your psychiatry class also. So guys, this is all from my side. I have tried to cover the most important 30 topics from the pharmacology, and in these 30 topics I have tried to cover all the MCQs which are asked in your previous 3 or 4 year exam. I hope you people have enjoyed this session, and if you're watching it after this session, you're watching it as a deferred live, so please guys appreciate me, and please like this video if you people really like the content which I've shared with you. So guys, in case you have any doubt, you can please message me on this number. So for any kind of doubt, you can message me on this number. So 9999663325. So for any query, you can message me, and please mention your batch also. Look, like please mention, sir, we are from the FMG batch, so that accordingly I will answer. And guys, all the very best for your exam. So only 2 months are left. Keep working hard. Make your schedule. Stick to the schedule because the success is just waiting for you. So 2 months gap only. Success is on the other side of this 2 months. All the very best for your exam. Take care.